Can we hear each other?
Yeah, I think so. Perfect. Dear ladies and gentlemen, my name is Ilya. I teach here at the ESCI school. I'm teaching climate change and I'm teaching circular economy. I will be your host and moderator of this event. This event is called Sustainability Knowledge Prerequisite for Achieving Resilience in the Healthcare Systems. Dear ladies and gentlemen, we are aware of the unprecedented change of the environment that we are facing, and that is very well documented in the scientific literature. And we all know that actually the health system is our first line of defense. However, that unprecedented changes of the environment actually are resulting with additional pressure on the healthcare system because of the increased number of patients and unknown diseases for the certain region that are occurring as we speak. Therefore, the achieving of more resilient and sustainable healthcare system is a prerequisite for the humanity, and one of the biggest challenges that the humanity is facing as we speak. In this event, through a series of keynote speeches, circularity strategies, strategies for mitigation of climate change, and as well exchanges of best experiences, we will try to initiate the increase of knowledge in the field of sustainability of the healthcare systems. Without further ado, I would like to ask on stage the Executive Director of ESCI, Agustin Lucia, to give us a welcoming speech.
Welcome everyone. Let me introduce myself. I'm Agustin Lujo, Managing Director of ESCI-UPF, and it's an honor and a privilege to extend a warm welcome to you all to this conference organized in the frame of the DesHealth Project. On behalf of ESCI-UPF, I would like to express our deep gratitude to everyone who has made this conference possible. Your presence here demonstrates that you share our belief that education, knowledge, and innovation are the key tools for building a sustainable world. Today, we gather not only to discuss ideas, but also to forge alliances and create tangible solutions. At this business school, we believe that sustainability is not just an ethical responsibility, but also a strategic opportunity. Companies that embrace sustainable practices are better positioned to thrive in the 21st century. This is why we have the UNESCO Chair in Life Cycle and Climate Change, whose mission is to create and transfer knowledge to society in the field of sustainability. This chair has led the organization of these sessions, and I would like to take this opportunity to thank them for the hard work and dedication. Over the next few days, we will explore topics such as the necessity for health system improvements, practical examples of sustainability enhancement, and sustainability education. We will have the privilege of learning from and listening to experts from various fields and countries who will share valuable insights and knowledge. I invite you to actively participate in discussions, share ideas, and establish meaningful connections. Together, we can create a future where sustainability and business success go hand in hand. Once again, welcome to this DesHealth event. We hope it will be a space for learning, inspiration, and collaboration. Thank you very much, and welcome.
Thank you very much, Agustin. The ESCI school, where we are as we speak, is part of the University of Pompeu Fabra. And in Pompeu Fabra, there is one very interesting initiative called Planetary Well-Being, which is a multidisciplinary research initiative which focuses on all three pillars of sustainability: the social, the economic, and the environmental one. We are having the director of the Planetary Well-Being Initiative, Dr. Carla Lancelotti, with us.
Thank you. Welcome, everyone. Thank you for inviting me to give this
very brief speech about UPF and its commitment to the concept of sustainability and health. As you heard in the introduction, my name is Carla Lancelotti. I'm the director of the Center for Study for Planetary Wellbeing, which has health and sustainability as main pillars of its activity. Health, mainly because the very concept of planetary well-being is a development, let's say, of the planetary health concept, right? It was based on the concept of planetary health and elevated to intend health as a wider concept of well-being. Health and well-being for people, society, and the environment, understanding that these three spheres are interconnected and the well-being of one is dependent on the well-being of the other two. As you might be aware, UPF has several programs that are centered along the concept of health. Since 2006, we have a master in public health in collaboration with the Università Autónoma de Barcelona, and also more recently, we are co-coordinating a master in planetary health together with UOC, Università Oberta de Catalunya, and is global. So as you see, UPF is committed to bring forward these concepts. But sustainability is at large a pillar of the university through our Vice Rectorate for Sustainability and Social Commitment. The university is focused and committed in introducing the concepts of sustainability at large and planetary well-being in all its spheres, the education, the research, and the institutional ambit. So I'm very happy to be here today and to actually listen to the talks. I'm going to learn a lot because I'm from the humanities, so totally different field. But I'm pretty sure that it will be very enriching for all of you and for me as well. So thank you very much again for having me, and have a productive workshop.
Thank you very much, Dr. Lancelotti. We are very happy to have you. So, guys, in the policy development, we are usually saying that, and especially in the sustainability field, we are saying that all the first things and all the good things are starting from Brussels. And we will start actually from Brussels this time as well. We are having a representative from the Healthcare Without Harm Europe, and that's Anastasia Martinenko, who is responsible for circular economy and educational activities of the healthcare without harm. And she is responsible for developing the training programs in cooperation with the educational institutions around the world. So Marty, if you can help us out and connect Ms. Martinenko. Here we go. Can you hear us, Anastasia? We cannot hear you. Let's try. Perfect. Now it's perfect.
Okay. Good. I can start, yeah?
Yeah, the floor is yours.
Great. Thank you. It's great to see you. Unfortunately, I don't see everyone online, but I believe there's many people. So glad to join you at this event. Thank you for the invitation. And I'm joining at the moment from the rainy Dublin, actually, which is not a big difference. Brussels is also quite rainy sometimes. So very short, I'm Circular Economy Research and Training Coordinator, as Ilya has said, for the organization Healthcare Without Harm Europe. We're a global organization. I work in the European office. So we work to create sustainable healthcare sector. And that's the one that does no harm to the planet and the patients, as was said already. I am very passionate about three topics, and they're all relevant for today's event. One of them is education. I believe that it's a key to any change that we want to create, be it a change in thinking, in attitude, in behavior. And I'm very glad to see many educational projects happening, especially collaborative ones like this project, DesHealth, that appear in sustainable healthcare. The second topic I'm very passionate about is environment and its connection to our health. And my expertise lies in waste prevention and chemicals and toxicity and their impact on our health. So with Healthcare.harm, we work on a few projects where we try to reduce the impact on health of people and planet. Like, for example, at the moment, I'm designing trainings for healthcare professionals in German hospitals to reduce the use of PVC in their medical devices and in general in hospitals. We try to educate the healthcare professionals on the impacts of PVC and how can they change and find safer alternatives. So these sort of projects really help us improve the health through education and improve the environment also, in condition of environment. And the third topic I'm very passionate about is psychology. And I believe that knowing ourselves better, knowing how we operate as a human being, how our brain operates, can help us improve the state of the other two topics, of the environment and education. So if we understand better how we actually learn and how can we help create motivation in people and how can we tackle misconceptions, and there are lots of misconceptions in sustainability and in sustainable healthcare, of course, as well. So knowing better how we work as human beings, knowing better psychology, can help us also learn better and teach better. So let me make an example. For example, can you imagine or try and take a moment to remember any moment when you were going through a course or watching some webinar or being at a seminar in person? And at the end of it, did it ever happen to you that you don't actually remember as much as you wish you did? If it ever happened to you, it happens to everyone. That's the way that education, unfortunately, works at the moment. And rarely we see very effective educational activities and courses and trainings, but very often they're based on a lot of one person talking and maybe some gamification and this sort of activities. Some learning strategies are effective and some learning strategies and teaching strategies, unfortunately, are not effective. But it's really good that we already have enough research and enough knowledge to know which strategies are effective. We just need to kind of connect all these dots and really implement them in our educational activities. So we as educators in healthcare, but also we're learners in many other circumstances, we may feel sometimes disappointed if we put a lot of hours into creating a course or going through a course ourselves, and then not remembering as much as we want, or not remembering it long term. You know, you may remember it tomorrow or in a week, but do you actually remember it in 6 months? And does it transfer into real behavioral change? So we put a lot of hours and a lot of effort into creating these activities, and we would like this to result into the change of thinking, behavior, and attitudes again. So taking into account the latest research in educational psychology, neuropsychology, there's lots of tips that can help us, and I'd like to name just a few of them. For example, we cannot give knowledge to someone because knowledge is created in the brain of a learner. This is already proven. And what we can do, we can design a space where there is an effort, where there are mistakes, productive failure, where there is active thinking and connection of the material, where the neuron connections are actually created. So we as educators can create space for all of that. Otherwise, if we just provide information, it doesn't necessarily transfer into the real knowledge and long-term learning. And there are also some learning strategies that learners can use themselves to help them learn better, like retrieval practice or interleaving and some others. So this is one point. Another point is that we unfortunately cannot motivate people. We cannot give motivation to someone, but we can create conditions where this motivation would arise. And for this, we need to support the basic needs of the learners. Those basic needs are relatedness. When I'm looking at you and you see my interest in you, and I'm there to help. Unfortunately, I don't see many of you now, being online and not in the same city, but still, I'm trying to create this sort of relatedness. The another need that must be supported in order for motivation to appear is competence. So, for example, maybe you expect the healthcare professionals in your facility to separate waste better, but they don't, even though they've been through some training. And one of the reasons why it doesn't work, maybe because their need of competence is not supported. Maybe they don't know how exactly they should separate it, or they have some questions, they're not sure, and they don't know who to ask. And I'm pretty sure this happens to many of us because in this case, we might be very confused with lots of different waste separation systems in many different cities, or even within just one facility. Another need that may also be not supported, and that's why there is no motivation, is autonomy, the third basic need. It means that maybe our colleagues, healthcare professionals, they just haven't found their own reason why they should do that. And it's really important not to tell people why it's important to do changes, but to help them find their own reason. This creates autonomy, and this is how we can support this need and create the conditions for motivation to appear. So this is my second point. We should support the needs of the learners and as much as possible in our educational activities in order to achieve sustainable healthcare. And the last point that I'd like to make is that we can't, unfortunately, come and say which solutions are good and which solutions are bad, which work and which don't, because the time is changing all the time. We as educators, we come and then we leave and continue work, and we want our students or those who go through our courses, we want them to remember and continue the change. So the new materials will appear, the new greenwashing tactics will appear, and we will not be there to help, very possibly. So what we can do is we can help and help them understand how to find out which solution is better. We can help them to understand where to find information better. Also, we can create a sort of collaborations like this one, a good example, or other collaborations where they know they can turn up and ask questions and try and learn better, where there is knowledge and research that's constantly happening. So we as educators should provide them with a skill how to identify which solutions are better, rather than just say what is good and what is bad. And so these are my main points. And I'd like to say that I'm really glad to be even joining online, and I'd like to see more events happening, more events like this. I'd like to see more collaborations happening with what I have just said in mind. And thank you.
Thank you very much, dear Anastasia. I hope that we won't have similar experience as your first point, that everybody will forget about everything that we were speaking right after the conference. Dear ladies and gentlemen, ICE Global is the leading research institution in Catalonia dedicated to improvement of human health through multidisciplinary research, innovation, policy and advocacy, with a strong focus on environmental and climate-related health impacts. From ICE Global, we are having Dr. Josep Maria Anto. Actually, he's a double doctor. He is a medical doctor and he holds a PhD. He's a professor of medicine at the University of Pompeu Fabra. He used to serve as a scientific director of the IS Global, and he received multiple prizes that I cannot, the names I cannot even pronounce. Just press the green button and it will follow the slides. His keynote speech would be the influence on climate change on the healthcare systems. Professor?
So thank you so much, Ilya. It's a big pleasure to participate in this health event. You see that the title of my presentation is Influence of Climate Change on the Healthcare Systems. As Ilya said, once upon a time I was a physician. Currently I'm professor of medicine and still research professor at ES Global. And to address this issue, which is the influence of climate change on the healthcare system, I would like to start with a very broad way. And the broad way, I'm sure that most of you are very familiar with this slide. I think that this slide, that it's just one of the slides of the planetary health boundary, the planetary boundaries framework, it's extremely useful because it puts together a huge amount of research and evidence from different fields. We have the IPCC every 5 years, a huge exercise, the International Panel, United Nations on Climate Change. We have a similar one in biodiversity, and we have plenty of large science synthesis efforts that put together how science is evolving. But we don't have many frameworks to give a synthetic view of what is going on. And this is one of the good frameworks. And what this framework shows is that in all these Earth systems, which is the climate, the biosphere, the land, the fresh water, and so and so, in each of them, there are scientists, basically earth scientists and related fields, that can measure some parameters of the Earth system that allows to understand whether the system is keeping relatively stable, as it has been in the last 10,000 years during the Holocene, or whether the system is moving to instability. Instability in climate or in biodiversity or in land means big events that sometimes cannot be predicted, that can influence a lot the societies in the world. The conclusion of the last assessment that was published in 2023, it was that in 6 of the 9 planetary boundaries, we have already transgressed the limits of stability. Very interestingly, the same year there was a paper where social scientists joined the framework and they were able to put safe and just limits. And when you take the justice in addition to safety, then they say 8 boundaries have been transgressed. At the end, this is what sustains the statements of Antonio Guterres, the General Director of the United Nations, saying, well, this is what is happening with the planet is the greatest threat for the humanity. What is behind these sentences is this type of scientific evidence. So for us who work in the field of health, the question is how much this means for health, how we can put health on this scheme. And 10 years ago, there was this huge report in the Lancet journal titled Safeguarding Human Health in the Anthropocenic Epoch. And in this 50 pages report, the authors, there was a multidisciplinary team, suggested that we need to change the concept of human health. And then not longer to talk about human health alone, but to talk about planetary health. And talk about planetary health because there is evidence that the health of the planet, which means the health of the Earth systems plus the health of all living beings, is intimately related to the human health. You cannot separate these 2 types of health. There is no human health without the health of the planet. And here is what came this idea of planetary health. You may have heard about One Health. It's a very similar concept in the domain of infectious diseases, but basically the similar concept. Well, during these 10 years, this concept of planetary health has been growing, has been evolving, and one way to put this concept in practice that you use in my teaching is this idea of let's be simple and just think about any kind of issue related to health in 2 dimensions: human health and the health of the planet. Again, plants, animals, earth systems, and so on. And then what is good and bad, and what is good and bad. And then very, very simply, you have one area, one cell, which is good and good. And this obviously is what we should aim for. Example, sustainable cities where we reduce emissions, where we reduce environmental impact, sustainable food systems. There is a growing list of strategies that are good for the human health and good for the planet. This is a very exciting area of new evidence coming. And in the other side, you have what is bad, and probably the things that doesn't make any rational sense. It can make economic sense or political, but not rational sense. And one example that may not be, the first one you would put is smoking. And it's the first, because we know it's a huge impact on human health, but it's again a huge impact on health of the planet. Desertification, one of the more destructive environmental practices according to WHO. And then you have the 2 complex cells, the trade-offs. One which is good for us and bad for the planet, and the other one which is bad for us and good for the planet. I will not talk about the last one. I'm convinced that COVID has been bad both for humans and for the planet at the end of the day. But I will talk about the other one, good for us, bad for the planet. One clear stance, healthcare. So healthcare is good for the human health when it's properly managed, but it's bad for the planet. And then this has emerged with one of the large areas in planetary health, how we can transform healthcare in a way that it moves from this cell to the other cell, making it good for humans and good for the planet. And here there are 2 concepts that are important. One is mitigation and the other one is adaptation, because probably the strategy to make the healthcare good for humans and good for the planet is to mitigate the environmental impacts. And again, this slide goes back to the first one. Unfortunately, we are not talking only about climate. We are talking about biodiversity, loss of species, loss of biodiversity, loss of water, distortion of the geochemical fluxes of phosphorus and nitrogen. And here you have, this is the Dutch healthcare system, and it's this kind of assessment that these guys here in the ESCI are masters in performing, and probably some of you too. But what these people have been able to assess is that 30% of the footprint of material extraction in the Dutch footprint, it's healthcare. And you see the impact similar, very large. So we need urgently to decrease these impacts. And this is mitigation. Some of these impacts are going to be here for decades, or maybe for the rest of the century. And we need to some way adapt to these impacts. This is a study we did in our center showing that the heat wave of 2022, the excess death in Europe was 61,000 people, excess death in Europe during the summer 2022. Many cities in Europe have heat wave protection plans. So this means these protection plans do not work well enough. Okay? And this is a huge, 5 years ago, probably we put less emphasis on adaptation. Today we realize that unfortunately this is becoming, again, an urgent need. And I'm going to finish with this slide that I love. It's from Healthcare Without Harm, which to me makes a perfect synthesis of which is the main challenge or the roadmap in healthcare. And it's basically for take responsibility of our role, and I think this goes deep to the ethics foundation of medicine and healthcare. Just respond to the needs of adaptation, respond to the needs of mitigation, and very important, take leadership and try to lead not only within the healthcare, but also beyond. And ATTACH, probably you are familiar, ATTACH is a recent initiative by WHO who supports national governments to adopt the sustainable transformation of healthcare. Finally, just to put you two examples of the things that we are doing here on planetary health. One is Professor Carla Lancelotti mentioned, the Master of Planetary Health. We launched the Master during the first year of the epidemic. Probably was one of the first masters. It's very challenging because the interdisciplinarity. This is not easy to really manage and to respond to the challenges, but we are happy. It's two universities and ES Global, and it's now in the 5th edition. And then very recently, and you will have the presentation by Miguel Ángel Martínez here, we had the opportunity to make an alliance with a hospital near to Barcelona, Hospital de Mollet, which is exemplary in sustainable transformation. They started, well, Miguel Ángel will tell you, when I discovered it, I was fascinated. So we sit together and we have created a Center for the Development of Planetary Health. It's a small project, but we are very excited to make this a reality. We have Marta Paisa somewhere here, which is the recently joined as director of the center, and you are all invited to know more about this, contacting us. So thanks a lot for your attention. Thank you very much.
Thank you very much, Dr. Anton. From climate change and the influence of climate change on the health systems, we are moving to circular design strategies for the healthcare sector. Our next keynote speaker is Jan Karel Diel, and he is a full professor in design of inclusive, sustainable healthcare at the University of Technology in Delft. He has more than 30 years of practical experience, which resulted with several manuals which are used worldwide, and he's an expert in improving the sustainability of the healthcare systems. My dear colleague JC.
Thank you for the lovely words. Too much. Thank you, ladies and gentlemen, and to continue. So, I have my chair in both places, and I think that's so nice to be on one hand in a school of industrial design engineering, or an engineering school, and meanwhile to be in a large hospital, to combine those two kind of things. And that's all the time multidisciplinary work, and that's a little bit like what I want to talk about. Circular design strategies for the healthcare sector. So it really continues a little bit with your story just now. The Dutch, we like to collect all this kind of data. And what we see in the Netherlands that, yes, our healthcare sector is responsible for 13% of our materials consumption and 7% of our carbon footprint. And yes, that leads to a serious contribution to climate change, and in turn, climate change is resulting into floods in the global south, but also a lot of heat stress in our European kind of countries. And that heat stress, like you nicely were showing, or not nicely, but that's the reality, leads to new patients, and those new patients come to our hospital, and then we start to produce even more material consumption, and we create more carbon footprint, and then the circle is round. And of course, we have to make a radical breakthrough in this circle. So,
can I stop you just a bit? You have to speak over there, or we can give you the...
I will not jump around anymore. I will stay next. So, but what does it mean in practice? This is our Erasmus Medical Center in Rotterdam, in the middle of the city, and this is one of our intensive care. Then I can jump around. Thank you. This is one of our intensive care units, and it looks beautiful. Yeah. So this is one of our intensive care units, a beautiful place, full of technology, clean, empty, hygienic. And this is before the patient enters this. But this is how it looks like after our patients are leaving it. So we calculated that on average we create 7 full bags of waste per patient per day in our hospital on intensive care. And these are large numbers. And when we start to share that with our staff, with our management, with our stakeholders, yes, then it means that we have to take action. And these are some nice pictures from GreenCycle, a company in the middle of the Netherlands who is collecting valuable waste streams from hospitals. On the back you see all the blue wraps from the sterilization department, and in the front you see metal scissors, all single use. But in the middle, you see also all these kind of endocutters and staplers, all devices of around 500 euros, which are being used only one time, and then they will go to the incineration in Holland. So that means more or less each box here has a value of around 500,000 euros, which is being destroyed, almost like a villa. And that can be nicely demonstrated with this simple figure, which we use a lot of times, which we call the value hill, where we see on the left the supply chain, where we create in each step more value from extraction to manufacturing to assembly to retail, and then we sell it to the hospital. And after one-time use, boom, we flow it there on the other side of the value down to the incineration. All the value is destroyed in one step. Well, of course, there it means like, hey, everybody starts to get awake and we have to start thinking of taking action. Part of it in Holland is that we all together signed the so-called Green Deal for the healthcare sector, where we have 5 specific targets, and 2 of them are relevant for my talk now. One is to reduce the CO2 emissions by 55% by 2030 and to be climate neutral by 2050, but also to reduce the consumption of primary raw materials by 50% by 2030 and to be circular around 2050. And that's a big challenge. So for that, we have the so-called 10 R's. The different kind of circular design strategies, all starting with a R. On the top you see reuse, rethink, reduce. Then we have in the middle reuse, repair, refurbish, remanufacture. And on the bottom, the recycle and recover. And again, these strategies, you also can put them along that value hill where we try to keep the value of our materials and products on the top and try to avoid that they go down. But what does it mean again in practice? Because this is a lot of theory. So let's look on the left. Here we see 4 strategies who try to reduce the input of materials and products into our healthcare system. How can we redesign, reduce, refuse, and rethink our consumption of medical devices? One example, again from the same study in the beginning, is our material flow analysis in our intensive care, where we found out that we use 108 gloves per patient per day. Part of the problem is, for example, a really bad packaging of those gloves. If you take out one, sometimes 5 or 6 fall out and we have to dispose them. So we even dispose unused products into the incineration. And it's not strange when you see that to the right, how they are being packed in that product. One of the suggestions is that we're working with industry is to have a new packaging where they're more nicely stacked and where you take them out more easily to avoid that unused waste. But also, meanwhile, a product alone is not sufficient, but also to make awareness with our healthcare staff to understand why, when and why, how to use these gloves. So that way we can reduce it on the left side. There to the right, it's more like the challenge like, okay, once those devices are in our healthcare system, how can we reuse them or, for example, to remanufacture them? More challenging. So, for example, we are working with different medical industries to see how can we make these endocutters more sustainable and more circular. For example, can we make them hybrid, where you see the bottom part could be reused without cleaning too much, the middle part could be going to the sterilization department, and the top part we might still dispose of, so that at least 2/3 of the device could be reused in our own system. And last but not least, it's the circular strategies like once those products and materials leave our system, how can we do that again in a more sustainable way? Can we recycle them, or in the last case, can we recover some energy from there? But again, there are a lot of challenges there. For example, in our intensive care unit, we have on average per year 4,500 kilograms of plastic bags from dialysis bags and 4,500 kilograms dialysis bag plastics itself, together around 9,000, 10,000 kilograms. And we would love to recycle that. Well, again, our recycler wants to recycle it only when we take off all those connectors, because then it becomes a monomaterial for them, and otherwise it stays in mixed materials. So that means at the moment that our healthcare staff have to cut up all the connectors at the moment in order to get it recycled. So again, here we are working in a supply chain with plastic manufacturers to see how can we design dialysis bags which will be of one type of plastic or different type of plastic who can go together into the recycling. So you see that coming back. So this is shortly what I want to share with you about circular design strategies in the healthcare sector. And yes, those models are showing always a simplification of reality, because besides that, we have researchers to see how it is in the real world. And then you see that there, of course, are much more complex situations on the back there. And that there are also a lot of barriers, like this is coming out of a lot of interviews we did. What are the barriers to circularity in the real world? First of all, safety, infection and contamination risk and protocols. Then practical difficulties related to collection and separation logistics. We cannot separate in a hospital 100 different kind of streams. The space is not for that. Regulations that complicate the process, regulations even who are different between the different kind of countries in the European Union, but also a lot of unawareness about the complexity of the circular economy. Lastly saying, hoping with this that maybe in 5 years' time or 10 years' time that we can reduce at least half of this pile and that we will reuse it, and maybe in about 20 years' time that this pile will not be there at all and that all of it will be reused one or the other way through circular design strategies. That's what I wanted to share with you for this short presentation.
Thank you very much, JC. The mic. Okay. Thank you. So, dear ladies and gentlemen, I'm not sure whether you're aware, but if you ever done an environmental footprint of any sector of the healthcare facility, then you will find one inconvenient truth, that approximately 80% of the emissions are actually indirect, and they are very hard to be influenced by the hospital management. Meaning, those are coming from the procurement sector, and that's the topic of the next keynote speaker. That's Elisa Franz, who will speak about the sustainability and the role of procurement in the healthcare sector. Elisa Franz is a CEO and co-founder of the Health Proc Europe Association, and she advocates for 15,000 hospitals across Europe in terms of achieving sustainability from the procurement sector. Elisa, she is calling from Berlin. Elisa, can we hear each other?
Ilya. Yes, thank you for the introduction. I hope you can hear me.
Perfect, perfect.
Wonderful. Now we go to the second test and see if you can see my screen, and then I'm ready to start. So you're not yet seeing that in the presentation mode, correct? Are you seeing it now in the presentation mode?
Perfect.
Okay, wonderful. I don't see you anymore, but I'm going to get it started. So thanks for the introduction. Hello to everyone. I'm Elisa, and I'm leading Health Proc Europe, an association that amplifies the voices of procurement in healthcare. And therefore, I'm actually quite excited to present to you the perspective of procurement here today. So maybe you are aware, the healthcare sector contributes over 4% of the global CO2 emissions. That is more than aviation and shipping industry combined. So now looking at that global number and bringing that number into what that means for most industrialized nations, we're actually looking at 10% of national emissions. And what we have been hearing from the previous speakers, hospitals are meant here to heal people, but their environmental impact is making the planet sicker. So that means that the healthcare sector actually faces not only the challenge in responding to the threat of global health, but also needs to find measures to reduce the causes of climate change itself. And therefore, I want to talk about an often overlooked yet incredibly powerful lever for change, procurement. Because the way we source, the way we purchase and manage, for example, medical supplies, can transform healthcare into a force for sustainability. So we either drive sustainability or we deepen the crisis through our ways of buying and sourcing. And in my world, procurement isn't just a back office function, it's the heartbeat of sustainable healthcare. Because the procurement departments of healthcare providers have a significant purchasing power and therefore a strong influential position when it comes to the decarbonization whilst improving the social impact of the healthcare system. With the goal number 12 being one of the 17 Sustainable Development Goals, advocating for more responsible consumption and production, it is within healthcare that we need to develop solutions on how to decrease, and this is more between 60 to 70% of emissions that derive from supply chains. That means what we buy matters. And that also means that through our procurement, we can look into cost savings, we can look into decreasing the footprint. We, of course, want to look into indirectly benefiting health and safety, creating resilience in the healthcare systems, and having a strong benefit on the community. I think that is, we would agree on all of that. How do we achieve that? And we have been hearing that already in the previous talks. We need strong leadership, we need trusted collaborations and partnerships, because what we buy matters. So how does it break down into looking into the majority of hospitals' carbon footprints coming from its supply chain? Well, simply saying, procurement touches everything in a hospital, because emissions are embedded in every single product, independent if it is a single-use plastic or if it is a pharmaceutical production. And if we think about the US that wastes or that generates waste annually of 5 million tons, I think that's a big number. And if you have a hard time, because I have a hard time imagining of what that means, like what's the image behind, that equals to filling up 2,000 Olympic swimming pools with hospital waste every year. And I think we have seen quite impressive pictures from the Erasmus Medical Center. Another image I want to draw in your minds is, imagine going grocery shopping and you fill up your whole cart with fresh food and then you throw away 1/3 of it before ever taking a bite. That's what happens in hospitals with medical supplies, wasted before they're even used. So looking into the ethical responsibility of healthcare, we cannot save lives at the cost of the planet. And I would go a step beyond and even say this isn't just an environmental problem, that's an economic one. Because if we do not rethink how we procure, hospitals will continue waste money and resources. Of course, there are other hidden costs without going into detail now, but looking into reputational damage, looking into employee retention and satisfaction, looking into the topics of supply chain disruption, or the impact of reduced financing and funding opportunities for hospitals due to not complying to sustainability. So how do we fix that? What do we do? As I say, I'm advocating here for procurement because I see procurement as one of the game changers when it comes to sustainability through sustainable procurement. And sustainable procurement, from my perspective, helps to make informed choices. Informed choices to reduce carbon emissions by choosing low carbon medical devices, for example, or choosing energy efficient products. Informed choices to sourcing from eco-conscious suppliers, reducing waste through the decrease of single-use plastic, and prioritizing local sourcing to cut emissions from transport. And last but not least, this is also for us from a procurement angle, the rethinking that is needed of how we construct tenders. Namely, that tenders need to be built in a way that sustainability criteria are added in and we shift away from price and quality only. So this is concept, this is theory, this is framework, but there are real world success stories out there. And I just want to name two. Looking into the Aarhus University Hospital in Denmark that has been introducing a sustainable procurement policy that helped to, one, reduce waste, and second, reduce the carbon footprint. And moreover, and I think that is the important story here, also helped achieve major cost savings while improving efficiency. On the other hand, looking into the Netherlands and circular economy, the switch to sterilized and reusable surgical instruments also helped save millions while cutting down on unnecessary waste. And I think this is the way to go. We need to identify what does good look like, and we need to understand that hospitals do not exist in isolation. The collaboration here is essential, and collaboration is essential in both ways, internally as well as externally. And I really want to motivate you and to see how important it is to bring procurement teams and sustainability teams together to align the vision and to make an action plan, because embedding sustainability metrics into procurement decisions is key to measure the success. On the other hand, externally, looking into partnering with the suppliers for greener solutions is important. So instead of buying the cheapest medical equipment, hospitals need to understand what are sustainable products that are available from the suppliers. And to give you here one simple example, the NHS in the UK, for example, negotiated greener contracts with medical suppliers aiming at an 80% emission reduction between 2028 to 2032 on their directly controlled emissions. So I think collaboration makes the difference between the wishful thinking and real world impact. What can you do? Because we have the power to start influencing this change, and the future of healthcare sustainability starts with all of us being here. I have decided for 3 main factors. One is we need transparency, and transparency goes along with we need to have clear data in order to make informed decisions or support to make informed decisions when it, for example, comes to the hospital supply chain emissions. We need to advocate for circularity also in procurement, and we need to bring along decision makers so that we can show the leadership that sustainability is cost and life-saving. So we as a collective, I would say, have the responsibility, and it is about starting now, if not even yesterday, strengthen internally and externally the collaboration, target low-hanging fruit, because the important is let's get that started, learn from best practices, join forces with others who want to make an impact, because every hospital purchase is a vote for the future we want, one that heals people without harming the planet. So what I want you to take away here today is healthcare emits more CO2 than aviation and shipping combined. Hospital emissions have a strong footprint in the supply chains, and collaboration is essential to actually move the needle when it comes to quite a complex topic around sustainability. Look beyond your organization, look into other countries. There is very good best practices and success stories out there. Learn from each other, implement and adopt it, because every purchase is a vote for a greener future. And I want to finish with a Native American proverb, because it seems that other cultures are smarter than we are, because when the last tree is cut down, the last fish is eaten, and the last stream poisoned, you will realize that you cannot eat money. And therefore, sustainable healthcare isn't a dream, it's a choice. And procurement is where the choice begins, where money is spent wisely. Let's make smart money decisions together. Thank you.
Thank you very much, Elisa. Thank you. I would like to thank all of the keynote speakers. Now we will start with the session number 1, and I would like to call on stage Dr. Alba Bala, Rosa Vidal, and Daniel Eriksson. We all know that individual actions, the individual actions are really important in order to achieve. Get yourself comfortable. Get yourself comfortable. We all know that the individual actions are super important. Pioneering is actually something which guides the sustainability further. However, the biggest problem and the biggest challenge lies in achieving systemic change, that transitional change towards sustainability, which is super important. And that is actually the topic of the session 1, which is called the necessity for health system improvement. Now, I would like to call, everybody can participate on site and online, and I would like to call the participants online, which we had a huge interest until yesterday. We had 80 registered participants. You can as well ask questions to the panel members. Just write a comment on the YouTube stream. Our first speaker is Dr. Alba Bala, who is an executive director of the UNESCO Chair in Life Cycle and Climate Change. Yeah,
Can I take that?
From over there. Alba Bala has approximately 20 years of experience in life cycle assessment and sustainable design of systems and products. Her speech is titled "Advancing the Climate Change Mitigation of the Catalan Health System," and it's a very practical lesson related to decreasing of the climate change impact of the Catalan health system. Alba, I think that
It's open.
it's
Okay.
either that one or yeah. Okay.
I'm going the other way around, I guess. Yeah, I'm trying to. Okay. Okay, so I'm going to narrow a little bit the scope. So I'm going to put the effort or the accent in how we can improve the climate change contribution or decrease the climate change contribution of the Catalan health system. And I'm going to explain it to you by our participation in a European project, which is called Catalyze. Okay, but before doing that, let me just spend like very few seconds, if I manage to like echo. It's that. I'm going the other way around. Why? It's the green one. The green. Okay. So we are the UNESCO Chair in Life Cycle and Climate Change, and we won in 2010 by a collaboration between UNESCO and the University Pompeu Fabra. And as our Managing Director Agustín Luojo mentioned at the beginning of the session, our mission is to put science at the service of society and also the environment. But what is important here is we are one of the research groups in this school, so we are the UNESCO Chair in Life Cycle and Climate Change, but we also have other research groups in our school. We have the Mango Chair in Corporate Social Responsibility, which is dealing with the social part of the of sustainability studies, and also the economic research in international studies and economics, which is the RISE, and we all together from time to time, we conduct complete sustainability assessment in the school, which is something that it's not common, but we have the possibility of doing this type of schools in SD. So just going back to the main topic of the session, so I'm going to focus in how we can just work in this or contribute to mitigate the contribution of the healthcare system. But for doing that, it's important, two things are very important. The first one is just to understand and to be able to measure what we are doing and we are going to do. And the second one, as we are dealing with such complex systems, it's important that we involve all the different stakeholders that are contributing to this system. So that means that we have to engage hospitals, we have to engage also the primary healthcare facilities, also industry, research centers, and even patients so in this process. And I'm going to tell you how we are doing this nowadays with this Catalyze project. The main goal of this Catalyze project is just to provide more knowledge. We have some knowledge. We have seen some sessions in the first part of this session today, but it's important to have more knowledge on that. So we want to, from one side, we want to understand how climate change is contributing to the health of the environment and also the people, but also the other way around. So we also want to analyze how the healthcare system is contributing to climate change. And we are involved in this part, and we are working on how we can decarbonize the healthcare system, especially in Catalonia, by doing a co-create strategy, just working with all the stakeholders involved in this process in Catalonia. What we have done, we started just conducting a very detailed and very systematic literature review, just trying to identify greenhouse procurement practices and greenhouse emission reduction practices and assessment and mitigation strategies. And we did it systematically, as I said, and we discovered that there were like 3 different approaches. From one side, some studies were doing like a top-down approach, using these input-output tables. Others were doing this bottom-up approach, just getting some direct data from the different facilities or centers, just getting real data like the greenhouse protocol or the ISO 14064 works, and sometimes some hybrid examples, just trying to combine when there were some gaps in data, they were just trying to fill in using this top-down or bottom-up approach. At the end, we identified 75 different mitigation strategies in this literature review, but we complete this analysis also analyzing different or checking some international best practices and case studies, and also identifying these case studies, especially in Catalonia, as the ones that has been released in this very nice example that we have in Catalonia. So at the end, what did it is just to try to identify from this list of strategies, we selected 54 strategies because those were the ones that it was possible to quantify. And we classify them in these 4 main topics, so energy and infrastructure, waste, transportation, anesthetic gases, procurement, supply chain. We've seen the importance of this part. water use, pharmacy, inhalers, and food. How we continued? After doing that, what we did was to engage the different stakeholders in Catalonia, and we start to see some memorandum of understanding with different strategic planners and partners and individual healthcare institutions. So at the end, we are nowadays, correct me if I'm not wrong, but I think that we are covering like half of the hospitals in Catalonia and 80% of primary healthcare system facilities or institutions. Once we had all these people on board, we started doing a survey to all of them, just try to see what was the level of implementation of the strategies that we identified first. And after that, we conducted a second part, which was a discussion, just to try to analyze the feasibility of implementing the strategies. So we started with sending this survey, classified in the different topics, and we listed the different strategies, and we asked them if these strategies were already implemented, if they were planning to do it in recent years, in 3-5 years long, or if they were not considering implementing these actions. After that, we conduct this second part, as I said, these discussion sessions, in that case focusing on the real feasibility. And we were discussing, it was in not a quantitative, but a qualitative mode, just trying to identify if they were high feasibility to be implemented or low feasibility. Okay? So this is what we have done up to the moment, and nowadays we are gathering all the information of the different stakeholders to calculate the carbon footprint, and we are in parallel, we are doing the carbon footprint of the Catalan health system. And apart from that, so in this process, we are also just working on the methodology and how to apply and how to calculate it. And for instance, we are defining the baseline scenario, so because some of the strategies have been already implemented, so we have to be very precise what we are going to start to account for the improvement in the following years, so from 22 to 20,000. And we also have to define the mitigation scenarios that we are going to analyze in the future. In parallel, we are also considering how implementing or just including this life cycle thinking approach, is it what we have expertise in the cátedra, identifying some examples in which, for instance, by reducing the carbon footprint, we can increase the effect in other planetary boundaries or other environmental impacts. For instance, it is not a problem if we are reducing the amount of one specific material, but if we are changing one material from another one, perhaps by doing this reduction, perhaps we can have an effect and just to increase our impact on acidification or in water scarcity or whatever. So we are also including this life cycle thinking approach in the analysis. So at the end, what we want to do is to have a guideline for the Catalan health system by the end of this year. So in 1 year, I will be more able to just do how in Catalonia we are just facing this problem and how we can reduce the environmental contribution of that. And I would like to finalize my speech just putting the list of the institutions that are already collaborating in these projects. But if someone of you has not joined yet, and if you are interested, we will more than welcome to have you on board. So please feel free to contact us, and you have our contact details at the end. So yeah, we'll be more than welcome to have you on board. Thank you.
Don't turn it off. Thank you very much, Dr. Bala. Exchanging of best practices is extremely important for sharing best experiences, and that is actually exactly the role of La Unió, the Union of Hospitals of Catalonia. And we are having a representative from the union, is Rosa Vidal, to present another interesting aspect in improving of sustainability of the hospitals in Catalonia.
Hello everyone. Oops, sorry. Hello everyone. I'm Rosa Vidal from La Unió, and as you said in the previous slide, our logo was in the final slide of the Catalyze project because we are collaborating with them. So it's a nice introduction for us. So thank you very much. Who we are? We are a little part, no, not a little, we are a great part of what's happening in the healthcare system in Catalonia. So La Unió, we are an association of providers. We are not the whole system. So a great number of providers of healthcare in Catalonia, both public and private healthcare providers, are associates of our association. We are so what we have is hospitals, primary healthcare facilities, mental health facilities, intermediate care, social services. So we have a lot of different facilities. We are in the whole territory of Catalonia, so you can find associates from La Unió here in Barcelona, in the Pyrenees, or on the south of Catalonia. And we represent all kinds of ownerships, not only public hospitals, not only private hospitals, but multi-facilities taking into account ownership. So this is who we are. You have been talking about the relationship between climate and health. As a healthcare system, we have a great impact on climate change, but on the other hand, we have to take care of people due to the illness and the impact of climate change on their health. So this is our first idea. There is, I like your slide, because that's perfect. It's what we do. We have this cycle connected. So what are the objectives of our project? We want to promote, don't forget that we are an association of providers. So we want to promote initiatives from raising awareness within organization stakeholders. We don't own facilities, so we put the table and our associates talk, share, create things between them in our house. So we work for them and with them. So we want to inform, we want to monitor some outcomes, and we want to be present in sessions like this, presenting our program and presenting what our associates do. So this is our main project. We have 4 items: the driving group, the conceptual framework, our manifesto, that's like the roadmap, that's what we are looking for, what we want to achieve, and finally, our lines of action. The conceptual framework, we take into account what WHO, Healthcare Without Harm, and CDC are saying about climate change. And I would like to put some explanation in these slides, because this slide is created by Mutua de Terrassa, is one of our associates, one of the experiences that you will hear in the second part. And they defined 12 sectorial sustainability dimensions based on the model of the NHS in UK. So you can see the 12 sectoral sustainability dimensions that we are working for. From 1 until 11 is what in the UK are doing, and the last one, that is governance, it's something very powerful in Catalonia, taking into account the diversity of actors that we have in our healthcare. So this one is, I think that it's maybe the core of what we do, the governance, the sharing, the working together. You can see, as I said, our manifesto. You can see here the direct link. You can read on our website. It's our roadmap. It's what we want to do. These are all our commitments. So a lot of associates from La Unió now a part of the manifesto. We presented the manifesto last year in a session that we do on May. And now we have a lot of entities that have been working with La Unió who are part of the manifesto. So we are really, really happy to share that. And here you can see some lines of action that we are working: knowledge, awareness, training, intervention levels, and we had also partnerships and international relationships, because we are doing this with, as someone said before, in group, not alone. And here you can see some of the things that we did last year, taking into account that was our first year of working. So we are 1 year old. We present the project in some conference and different areas. As you know, last year here in Catalonia, we have a really serious problem with drought. So we did some awareness webinars about what we can do to reduce the consumption of water. We also do a session about the green pharmacy session, a workshop of carbon and water carbon footprint and water. And we obviously participate in the DesHealth project, and we did this survey. It's a survey that we share with all our associates in La Unió, and we collect data. So you can see here some of the first results of this survey. It's data from 2022. We have 50 answers. And now we have been collecting for the last 2 months that data from 2023, and now we have 57 answers. So we are improving, and we are working in the results here. Here you can see on average some data from these 50 answers, that they are 50 facilities that we have in the first place. Here you can see all the institutions that also participate in the survey. And here you can see also in the survey, we ask about electricity, waste, and water. And here you can see some data about what our associates tell us. And finally, given that I'm on time, past time. Some years ago, here in Catalonia, we have a motto, a public motto, that it was health in all policies. Now in La Unió, we change a little bit this motto, and we say sustainability in all our projects. So here you can see 2 other projects that we are working with, and we put the sustainability framework or the sustainability aspect in these 2 projects. This is a good practice community, and climate and health one of the boxes. And here you can see a prospective analysis about trends and tendencies, and we want to take into account also the environmental and sustainability aspect. So, health is the argument for climate action, is what they say in CAP last year. So I think that's our second motto after sustainability in all projects. So thank you very much.
Thank you very much, Rosa. Ladies and gentlemen, we are all aware that in the south of Europe we are doing things quite differently than the north, isn't it? That's kind of a stereotype in Europe. But therefore we have the next speaker. Next speaker is Mr. Daniel Eriksson, and he is coming from the European north. Let's see whether the things are being done differently in the north. Mr. Eriksson is a CEO and founder of the Nordic Center for Sustainable Healthcare and CEO of Tempo Foundation.
Thank you very much for having me. And the differences between the north and south when it comes to healthcare sustainability is getting less and less, I would say. Things are moving fast in Europe. We have the same legislation. And one of the things we started Nordic Center to have Nordic Center as the progress in the Nordics that could be sort of a role model for other countries. But today we do that together with other countries. And I think that Europe as a whole could be a global leader when it comes to healthcare sustainability. So I think the differences are not maybe north or south or east or western Europe. It's different within regions, within countries, where of course in each country some regions are excelling and others don't. And I see Catalonia is doing very, very well in this field. But I'm guessing maybe not all the regions in Spain. And the same goes in the north. Some places are doing very well on this and so on. I represent Nordic Center for Sustainable Healthcare. We have been around since 2015, so we celebrate 10 years this year. But I've been working 20 years with sustainability in healthcare. So I started out at a university hospital as a sustainability officer, working with all these things we're discussing today back in the days. We are something, we are a network, a think tank, enabler. I don't know really what we are, something we are. We founded it and trying to find our role still 10 years later. We have a lot of members from all over the world. Some of them who have been mentioned here today. I saw you mentioning Medcare, for example, with the nitrous oxide destruction. That's one of our members. Elisa from Health Proc Europe that we saw is one of the members. And we are still called Nordic Center for Sustainable Healthcare, but we have members from New Zealand, so maybe Nordic is not. So we can say NCSH maybe in the future. And it's both hospitals, regions, universities, and so on, from India to Canada, to US, and so on. And one of the reasons we started this was I was, for example, in one of the boards of an organization that presented earlier today, and it's more of the NGO bubble, where you are a little bit detached from the hospital and so on. I was working in the hospital. We were in our own little bubble, working with other hospitals in the Nordics and didn't see that. And then we started to work with companies and so on, and they were also in their bubble, and the university is also in their bubble. So one of the reasons we started Nordic Center to get this cross-sectorial, that we get all the different stakeholders in sustainable healthcare under the same roof. So we want the hospitals to talk to companies, to talk to universities, to talk to state agencies and so on. We do a lot of different things. This is just an example of what you do. Different projects from all green hospitals in India to projects with Italy, to different models and reports and so on. And you can find all this on our webpage if you're interested. And I was asked here to talk about something systemic. And sorry, Politecnico di Torino and Amina, I still don't really know what systemic means, but I will give it a go. And my approach here today is a little bit from the company side, the life science medtech industry. And for those of you who have seen me presented before, I always show this model that we did many years ago. We see sustainability in healthcare as something that is cross-sectoral over many of the old silos. Sustainable healthcare isn't medtech or cleantech. It's cleantech with solutions for hospitals. It's medtech with good sustainability performance. It's when you construct, but only when you construct green hospitals and so on. So if you combine all this, sustainable healthcare is actually also quite a big part of the economy, a quite big part of the industry. If we we can look at the percent of GDP, of course, and so on. And so it's bigger than you thought, but it's heavily guarded. And you could put this in a university also, the different faculties that are divide themselves into these different silos. And the trouble with this, and correct me if this is not a systemic approach, Amina, but the problems with this is that many of the new solutions, innovations, the company, they don't identify with the old silos, but we build the innovation system, the startup system in these old silos. So many companies, they maybe are doing a green solutions within medtech that are linked to ICT that also involves the logistics. They don't belong to these old silos. So we need to think differently, both when it comes to innovations and from the university point of view. And we are at the Economica Business School today. Is one of the things that I always push, that the business schools need to be in this also. It's not just the engineering faculty and the medical faculty. It's also how do we fund this? How do we start companies? How do we get innovations? So healthcare sustainability is horizontal, and just so you know, the existing silos are heavily defended, both in the universities and if you look at the cluster side. So those who have this order, if it would be, you know, the EU want to divide themselves in, they have calls for life science or for clean tech and so on. And everyone that are in the system are, of course, anxious to keep it as they know it. So those silos are quite heavily hard to penetrate. And for the company side and from companies looking into green solutions and new innovations in hospitals, and I think Jan mentions a little bit of this before, but it's two approaches where many organizations forget one. Of course, you need to contribute to healthcare sustainability. You have a greener solution, something that saves something. But you also need to adapt to existing ecosystem. And there many forget. Contributing, of course, you lower the energy consumption or lowering CO2 or carbon capture storage availability. You get a lot of things. You can contribute to make a hospital greener. But you also need to adapt to existing solutions. And that might be so simple that you have something that needs to fit into something else. And if it doesn't do that, it doesn't matter how green it is. It needs something that follows the procedures from the doctor and the medical staff so it doesn't interrupt. It needs to follow chemical legislations and waste regulations that already exist. Different regional goals, practices, energy materials, and so on. So for many of these new innovation organizations, they come with a super, super good innovation. They will cut something with 80%, but will never be realized because it doesn't fit into the system. So these two parts of this, contribute and adapt. So the amazing world of healthcare sustainability and how you should fit in, you need to understand the complexity. And there is some articles that I know Amina has written about this, how complex this is, and maybe we'll show it later on. But the complexity is big, so you need to understand this and where you fit in. Keep track on all the different sustainability stakeholders there is on many levels, both vertical and horizontal. Old problems need new solution, but it's not necessarily the silos or stakeholders you think that will embrace that. And the system perspective is vital, and how do you fit into this? I also want to push a little bit. This will be released on Friday. It's our trend report on sustainable healthcare. So if you're interested, you can join us online. And it will be available later on for all the members. But we're looking at the different megatrends. I can give you some of them, megatrends we're looking at. And one is practical implementation. And we see now that the days are gone where you can have the different strategies and roadmaps and 2030, 2040. And implementation is everything. If I want to get fit for a beach this summer, I can have very plans, can't I? But it's the result that counts. So it's the same if you're looking at this. You can have any plans you want, vision, roadmaps, but it's the implementation that matters. And I'm myself very tired of going around Europe listening to high-level people talking about, from commission on different roadmaps and everything you know never be implemented. But as we see here from the Catalan region, those that are real measurable results, that is the only thing that will be something we look at in the future. And we also said that we will have more sustainable healthcare. That might be a very simple trend, but no matter who is in the office in the US and who has a trade deal with everyone, this role of sustainable healthcare is rolling. So we will have more the next coming years, no matter what happening, because of resource scarcity, because you have drought, so you need to save water. We are already working with new innovation. We need to save energy. So just by those different factors, we will see more sustainable healthcare next coming year. And there will be business opportunities and so on. And we're also looking into some market trends and how different areas in the world, and also micro trends that can be quite interesting if you are interested. Did I, 10 minutes? Exactly 10 minutes. Boom, drop the mic.
Exactly on time.
Thank you.
Yeah, Nordic punctuality. Thank you very much, Daniel. Now I would like to remind the participants from online, and even you participants here, you can join by asking questions, but I will misuse the microphone because I have one attached on myself, and I will ask the first question. So it was a very, very powerful presentations and very inspiring. However, where do you see, where is the missing link, or where is that niche that we would need to trigger in order to move from individual initiatives to a real systemic change in the healthcare sector? You have the microphone, Alba, it's right next to you. Yep.
I would say knowledge is everything. They like that at the university. No, but what we see, what I've seen, been many places the last 20 years looking into sustainable healthcare in different hospitals and companies, that people reinvent the wheel all the time. You go to a new country and they're so happy and they start a new project. And I was, they did it 15 years ago in Denmark. They did it, you know. So we are working to reinvent a lot. And I'm very happy you had from NHS, was it? You had stole it from NHS. Perfect. That is what we need. We don't need to reinvent the wheel, copy, paste, and innovate. And then we can start, you know, doing new innovations and new things. But I think that is a key.
Thank you, Daniel. So knowledge and innovation, and we are actually in an educational institution, and we are having the perfect speaker on that topic. You know, it works well.
Yeah, I don't know why I'm having a lot of problems with micros today. Yeah, I agree completely with you. So I think that, we need to increase the knowledge that we know, and also to share that knowledge, because sometimes we are working in the same fields and not sharing this knowledge. So I completely agree. I cannot add nothing else, I think, in this session. I think that it also try to find out how we can approach the different stakeholders and engage them, because sometimes we can work with our suppliers and we can find out a solution for an item that we are using in hospitals, but perhaps at the end the final users or the patients will not approve this. So I think we also need to communicate them and engage them in the processes to advance on that.
Rosa?
I think that the other step is also legislation and, you know, how the public system orders all of this material, because here in Catalonia, for example, now the Department of Health, that it's the Ministry of Health in Catalonia, is starting to act in sustainability or around climate change. What we can see now in Catalonia, and we have a lot of excellent examples, are from the hospitals, the facilities. We don't have the, you know, this companionship from the public sector from the beginning. Now they're entering like a role to do some of this journey together, because as you said, copy paste. So let's put all the knowledge in one place and let's copy paste together, because now what we have is some entities that are here and some other ones that are here. So we need this, you know, I think that we need this kind of legislation to improve what we have.
I just want to add one thing, because I might forget it otherwise. I need to say what I need to say directly, otherwise I forget it. But another thing is collaboration, and because of the complexity, we talked a lot here today about climate and other things, but look at a topic like pharmaceuticals in the wastewater. Big problem worldwide now, where we have pharmaceuticals that are not getting clean in the wastewater system. I think in Sweden at least we have 1,100 different substances that are pharmaceuticals, 1,100. And you know, there are no hospital, university, or institution in the world that knows how those 1,100 pharmaceuticals behaves in different types of sludge and wastewater and ozone depletion and so on. So the only way we can work on a topic like pharmaceuticals in wastewater is basically to have the combined world knowledge, or at least the European combined knowledge to make some approach. Because it's basically impossible to have the knowledge and the expertise in one university or one hospital or one region. It can't be done, basically. So collaboration is also the only way forward to work with this.
Thank you. Marta?
There were two questions where I have a mic, I think. One was related on how we can influence decision making, and the other was related with the impact of pharmaceuticals, and if you know some sustainable procurement practices in regards of pharmaceuticals. I think the first one you have already responded, but maybe the second one you can explain an example about that. Yes, the question would be if you know some practical examples of sustainable procurement for pharmaceuticals. Because as you mentioned, as Daniel mentioned it, the pharmaceutical sector has a very huge impact on water systems and ecosystems in general.
Probably.
Yes, I do. Yeah, but there are several of these, and the first one was in, there is a list in Sweden. It's been around for like 15 years, where you basically rank pharmaceuticals the same way we do as chemicals: persistence, bioaccumulation, toxicity, and they get a number, and you can use that for different purposes. Unfortunately, most pharmaceuticals don't have anything else to, use instead. You have one, I don't know what to call it in medicine, but a specific substance do something in your body, and you can't exchange that for something else. It's very rare you can exchange. I think it's naproxen and diclofenac or something they could exchange. The one was worse than the other from a pharmaceutical, from an environmental point of view. And there are several of these. But I was also, if you look at pharmaceuticals, you should also lift this sustainability in healthcare to another level. It might be research on precision medicine, so you can target cancer with only half of the cell toxins because you do it in a hormone. I don't know how to do it, but maybe you can also how you administrate the pharmaceutical with maybe less troubles and side effects for a patient, but also then using less pharmaceuticals. That is also working with pharmaceuticals in the environment. It's not just the end of pipe solutions.
In fact, this year in our group, Laia and Michelangelo, who will be speaking then a part of the group of La Unió, we talk about that in our first session this year, about how not just about procurement, but about pharmaceuticals. We are really concerned about pharmaceuticals. And as you can see in our project, green pharma is one of our boxes. So we don't have experiences yet, but maybe next year, if we do the another session, we can share with you some of the knowledge that we learned about procurement and pharma during this year.
Thank you, Rosa.
Just to add from that scientific point of view, I think that the main point nowadays is how to reduce desertification, and this is the clue, because we are reducing, if you are reducing the amount of pharma that we need, we are also contributing to this, to this reduction of the impact.
Yeah, there is a report on our webpage on this. You can work on, many different, from top to down, and the first full-scale wastewater treatment plant that actually reduced all pharmaceuticals in wastewater from a whole city actually has been built now. So there is solutions to work on, but that's an end-of-pipe solution. But you can also work on different things that they work on. It's hundreds of things you can do, so I can't tell them all, but it exists a lot. Google.
Thank you, Daniel. Do we have some questions from the audience here? Dhruv?
Yes. So
you wait for the mic, please?
Okay, yeah.
Perfect.
I was curious to know about the scope 3 emissions, which are specific to health sector, and are there any specific practices to reduce the scope 3 emissions?
Green procurement? Yeah.
What we learned from our associates is that scope 3 nowadays is like, I'm sorry for the expression that I'm going to use, is like a black hole. So we are trying to understand how we measure, and the first step is to measure it correctly or to estimate it as more correct as we can, and maybe then we can talk about reducing. But I think that the first step is trying to put a name and to put a correct measure in scope 3. I don't know if you agree or not, but that's my opinion, and that's what we learn from our associates.
Yeah, I completely agree, because when we conduct some LC assessment or whatever, usually the problem that we have is we don't have data. And with this time of industries, pharma specifically, they are reluctant to provide some data related to the specific pharma, because we have some confidential agreements, and formulations that cannot be just released like this. So we have this time of, we don't have real data to calculate what's the real scope 3 impact of that one. So we can work in a singular basis with some suppliers trying to reduce, but to have the whole picture, I think it's quite difficult because we don't have data for doing that.
Yeah, and I would go so far to say that this is something we need a new model of how to do, because if you're looking at a hospital, maybe have, I don't know, 15,000 different products to buy. How are you going to get data on that? You ask the suppliers, but who is going to validate that from the suppliers? Are we going to build up a enormous global consultancy that is every prices will go up, and it will be very complex, and how to work with that. With that said, some are working with scope 3, starting with the biggest volume and moving further down. But to get a complete view on scope 3 in healthcare, we need some kind of new blockchain thing that, I don't know, it needs to be something we don't do today, because each hospital or region or even country following that up. NHS is now putting the demands on the suppliers to bring in data, but who is going to validate that data? Everyone has been doing LCAs, knows how many assumptions you can do, and I can assure you, if you're a company putting in data to NHS, all the assumptions will be to your advantage, of course. Yeah.
There's something that perhaps is previous, is the information that is gathered in hospitals, but perhaps you have a list of items that they purchase, but you have gloves, but you don't know nothing else that's gloves. And it's different if they are made of one specific plastic or another one. So we even in primary source, we don't have enough information just to trace and to find out what we want to analyze. So I think more data is needed to perform it. And yeah.
And also, you add on to the problem with those that actually, you're just looking at the products in scope 3. Those who actually in there, when you use them, will reduce something, because you maybe have something that I don't know how to explain it, but you have a smarter tool that will reduce so you also need to look at some kind of life cycle, not just what you get inside the doors, but also when you use it, is it better than something else? It might be, a little bit more CO2, but it will reduce the chemical use in the hospital by large amounts. So how do you measure and how do you calculate? It's very complicated. And I don't understand those who are doing this. I think this seems very complicated.
Thank you, Daniel. I think that we have another question. Can you?
Hi. Now.
Perfect.
Mr. Eriksson, since you were pointing to implementation, I think quite fiercely, would you mind to share with us some insights from your experience, 3 or 4 insights from your experience regarding implementation?
Yeah, there are many super good examples, and I could sit here for many days. But if you go to our webpage, we have something called Nordic Know-how on sustainable healthcare. It's different reports that we have done on specific topics like geothermal energy in healthcare, or ventilation, or we have renewable energy sources. And each of those reports, lists those best practices. And we also have a web page called worldsgreenesthospital.org, where we also put in solutions that exist today, that you can buy today, basically, that are installed in Nordic hospitals in this case. And it is not visions or something that will happen 2030. It's solutions that exist today and are installed in hospital. So, but there are many best practices. Also some of them also listed in this project. So you can find the DesHealth reports with best practice.
Any other questions? Yep. Benny?
Thank you very much. Yes, I had a question regarding, do you have like any insights on how sustainability influences the treatment decisions made in a hospital? Or are there like any more efforts in prevention? Because I think like avoiding operations in favor of like alternative treatments are more sustainable, I guess.
Well, that's one of the things we discussed when the project we listed all the solutions for pharmaceuticals in the environment. And some things are, if you have a bad knee, if you get your surgery faster, of course you will eat less painkillers for a so it's basically those kinds of things that should have been both good for a patient and for the economy as a whole, and for the environment in this case. So I would say faster treatment is one of these things that would actually benefit most.
We also, in this literature review that we conducted, we found out that the anesthetic gases that are used and how they are used in surgeries has a lot of impact. So this is one of the hotspots to analyze these anesthetic gases. So there are some alternatives.
And now one of the main topics is the inhalers that we are using, and we are changing to, I don't know the name in English, but you know, the common inhaler that we are using sometimes had a lot of gas, so it has a great impact on the atmosphere, and we are changing, or the prescriptions are trying to change to another kind of inhalers that, I don't know the name in English, is Pol Seca in Catalan. Powder, no, great. Powder that they are much better than the common inhaler. So we can do things. And I think that what's much better than that nowadays is that the patient is aware of that. So sometimes the patient says to the doctor, okay, this inhaler, what happens with this inhaler? Now, this is happening now. So I think that maybe patients have to be another slide that we have to put in all of this, because if we have patients going through sustainability, maybe the change could be faster or could be even better. So we don't have to forget about patients when we want to achieve sustainability.
Any other question from the audience or comment?
I can circle back to you a little bit. And when I was working in a hospital as a sustainability officer, it was very hard because we can't get into the medical decisions. That is a fact. We can't, so we circle around that with it. So that's why it's super important to get doctors and surgeons and those that are really working with the patients to think in those terms, because they can make huge changes. And one thing that we can say, the enemy of sustainability in hospitals are the hygiene people. You know that? That's our common enemy, because they want to make everything single use. And their job is to find some obscure report that lists a risk of some bug in something, and they're single use, And as a sustainability persons like me, I can't say anything about that, because that's a medical decision and they decide it. But a doctor can say, doesn't matter, that risk we can live with. That is a medical professional can say that. So they are very important to stop the hygiene people, so they don't make everything single use.
That's exactly why in our project we put the governance box in a different color, and we thought that it's the box, because if we have the government inside the hospital and around the hospital, and all from the CEO to all the workers in the hospital, we are in the same, we are thinking the same, and we are going towards the same, the result is much better. So we think governance and putting doctors, and not just doctors, everyone in the hospital or in the medical facility or whatever, we can achieve better results. So it's that we think that governance is a key role in all of that.
Thank you. Yep, Olena.
Yes, hello. So I just wanted, building on what you said, I wanted to offer the medical perspective. I trained as a medical doctor back in Canada. Now I work more on public health and climate change and sustainability issues. But I think that an argument that is not enough made is really the linkages between sustainability and quality of care and good patient health and good patient outcomes. So we talk a lot about saving the planet, saving money, but how about saving people through the decisions that we make and practicing better medicine by integrating sustainability into our medical choices, and not only for medical doctors, but also for other healthcare professionals. And actually there's enough data that shows that quality of care can be very well aligned with sustainability by improving the way that we treat people, by optimizing you might have heard about polypharmacy, when people take too many pills as compared to what they need. So by really optimizing that, paying special attention to good control for chronic conditions to avoid exacerbations. So it's not so much about saying, oh, what surgery can we avoid and prioritize alternative treatments. It's really about asking yourself the question as a medical professional, what is best for my patient? And actually, oftentimes, this can go hand in hand with sustainability. It's just that in many cases, unfortunately, in the modern medical system, we don't have time to properly, fully assess and have a very a complete picture about what would be actually helpful for patients. So I think sustainability is an opportunity to even improve the way that we help people, that we treat people. And I think that this is also, it opens that door to speak with medical professionals and try to make that argument by providing the necessary data, even when it comes to single use and hygiene, because there's even data that shows that single use is not always better for hygiene reasons, which I personally found very interesting when I first learned about it. And I think more medical professionals would benefit from that kind of knowledge. Thank you.
I want to take that a little bit step further even, because if you're looking at the biggest environmental impacts you can do in medicine, it's screening, early detection, and those kinds of things. And there are many studies now that they have showcasing. You're not, maybe you're not agreeing. No, but if you look in there are, for example, early detection of kidney diseases, where one of the big pharma did, and the amount of CO2 you would save instead of letting someone go into dialysis for, I don't know how many years. The amount of CO2 saved by early detection of kidney disease is enormous. But then comes the problem: who is going to pay for that screening? Because the pharma and medtech, they earn money when you get sick. They don't get any funds if you stop you from being sick. So then comes the financial system that will, basically put, I don't know the English expression for this, but so that's one of the reasons why this isn't done, as I understand it. So we need the business school to figure that out.
Thank you very much, Daniel. Unfortunately, because we are pressed with time, we had a lot of interesting discussion. I would like to congratulate all the speakers from the first session. Thank you very much. Give them a round of applause, please. And I would like to call the speakers from the second session: Miguel Angel, Laia Zarza, Jesper, and Maria. We all know that even the trip to Everest actually starts with a single step. In order to achieve systemic change in sustainability, we need individual actions. And we spoke during the discussion about something which is called the best practices. Well, I think that in Catalonia we do have a lot. And one of the brightest examples of implementing sustainability in one hospital is the Fundació Sanitària de Mollet. And the first speaker is Sustainability Director, Miguel Ángel Martínez, and he will present the sustainability pathway of his hospital.
I'm going to present a brief summary of our Green Hospital project. Our institution, the Fundació Sanitària Mollet, is a non-profit organization that provides public, social, and health services. We are located from about 18 kilometers from Barcelona, and we manage 7 centers. One of them is the Mollet Hospital University Hospital that has achieved the status of net zero hospital in direct emissions. Our institutional purpose is improving our people's lives in a broader sense, because that includes taking care of the environment. In some moment we thought, instead of being part of the problem, we need to be part of the solution, and that is the origin of the Green Hospital project. We have been working in that project with a vision of continuous improvement, focusing also with a ESG vision, and our hospital opened its doors in 2010, and just 2 years after, in 2012, we implemented the ISO 14001, 14001, and 50001 management system for energy and environmental management. To that certification were followed by others like social responsible and healthy entity, FFQM, Joint Commission, and others. Our Green Hospital project relies in 4 main pillars. For me, the most important. In the other group, I'll talk about the governance. For me also, the governance is the most important in an institution. One of our institutional principles are divided in 4, and one of them is the green culture. Also, in all our strategic plans, the commitment with the climate actions is evident with measurable and quantifiable objectives. And on the other side, since the beginning, our CEO decided that our hospital need to have an energy management technician and also an environmental director, in that case myself, reporting directly to them. The other pillar is the structure and facilities of our hospital. As I said, the hospital opens its doors in 2010, and since 2006, the senior management participate in the design of the new building. For example, in 2010, our hospital had one of the biggest geothermal plants in Europe, also with system for rainwater collection, natural courtyards, sustainable architecture, radon sailings, and since 2017, all the energy of the hospital comes from renewable sources. And in 2020, during the pandemic, we implemented our photovoltaic plant. We have been doing other actions to improve our installation, but this is only one example. Now we are focused in promote the process improvement. For example, we are trying to reduce the days of stay at the hospital, also implementing new efficient products or systems like automatic cabinet for drug dispensation. We are recycling 29 types of wasting. For example, in the surgical area, we separate 13 different types of waste. Also, we have implemented capture filters for anesthetic gases. For example, we are doing a lot of efforts to avoid unnecessary travels and mobility. One of the examples is the nephrology area. 1/3 part of our users are doing the dialysis at home. Also, it's a benefit for their health, having the option to do that at home. Since 2012, when we implemented the environmental management system, the training in environmental good practice has been mandatory for all our professionals. 3 years ago, we decided to do a survey to verify if that green culture have arrived to all our professionals. The results were wonderful, and thanks to it, now we have 20 environmental ambassadors. All of them are volunteers. Each one represents one of the processes of our hospital. Our green culture strategy started from the top down and has gone to the bottom-up approach. Obviously, as you say before, it's very important our stakeholders. For that reason, we do a lot of activities with our citizens, for example, with schools, institutes, with other health entities. For example, we have a Patient and Family Engagement Council and also a Major Participation Council. We explain all the activities we are doing and collect information of their needs. Obviously, you say also, we need to date our knowledge, like today. And for that reason, we participate in activities with the institution like Geneva Sustainability Center, Healthcare Without Harm Congress, at the International Hospital Federation Congress, or with the Climate Change Office of Catalonia, with our partners of the Unió Catalana hospitals. We also participate in different studies, initiatives, working groups. Like Daniel said, sometimes the best practice is just to copy-paste the other practice of others. It's the truth. Thanks to it, we have achieved very important results. For example, instead, our activity has increased for about 50% since the beginning. We have achieved a reduction for about 26% water consumption, 36% of electricity consumption, or for the waste consumption. Also we have capture filters for anesthetic gases, thanks to good practice like low flow anesthesia, intravenous anesthesia. We also reduce the consumption of anesthetic gases. Related to CO2 emissions for Scope 1 and Scope 2, we have achieved an 81% of reduction. And 2 years ago, the Climate Change Office of Catalonia proposed to us to other two voluntary offset program. At the beginning, we thought it wasn't a good idea. The Climate Change Office explained the project. It's basically consists in funding another institution, non-profit organization, in different projects that reduce the same amount of emissions. Now, thanks to it, we have implemented actions in all the areas of the hospital. All the processes and all the areas have some actions implemented. Thanks to it also, we have obtained different awards. For example, last year by Healthcare Without Harm, or in the International Hospital Federation World Congress, that only help us to continue working and motivate more. And the future vision, we have defined a path to total net zero. We are focused in 2030 to be total net zero for scope 1 and 2. Probably in 2026 we will achieve. We are now focused on eliminate natural gas consumption, which is the source of that 9% of emissions. We are focused in 2014 to the supply chain decarbonization, and obviously to eliminate the residual emissions in 2050. But because there are some matters related with the economy and society that probably we don't control. And as Dr. Anto introduced, the new project is the Planetary Health Development Center. I don't go into to explain another time, but this center has two main areas of actions: the community strategies for planetary health, the decarbonization and environmental sustainability of the healthcare system, and the four objectives are promote educational and knowledge strategies, decarbonization and sustainability of the healthcare system, population strategy for planetary health, and good governance and accountability. And that's it. Thank you.
Miguel, this is not the only positive example that we are having in Catalonia. Another positive example comes from one hospital in Terrassa. It's the MUTE, the Terrassa University Hospital, and we are having with us Laia Zarza, who is a green commitment technician, if I translated that right from Catalan. Perfect.
My name is Laia Zarza and I'm the sustainability technician in Mutua Terrassa. Before we begin, let's understand what is Mutua Terrassa. We are a social benefit entity and we are part of the healthcare sector in a very transversal way. We have the Assistential Foundation of Mutua Terrassa that is in charge of a hospital, 9 primary healthcare centers, and also residencies and daycare centers. But we also have other activities like a research foundation for clinical practices, and also a laundry and sterilization enterprise for surgical textile and for different kind of material, sanitary material. Now you have more or less a wide framework of who we are. Let's talk about the main issue, the climate change. We are facing one of the biggest threats as a humanity now in the 21st century, and it's pretty curious, no? It's important to take action as healthcare sector because as we are the ones that are taking care of human well-being, we are being at the same time huge contributors to the negative effects that the climate change is causing in our citizens and in our own lives. We are the responsible of the 5% of the global net emissions it's an information that I'm sure you already know, but it's important to remark it. And to remark the huge paradox that means for us to be trying to take care of people and at the same time being contributors to the negative effects that the climate change is causing. So we decided to break with the circle in Mutua Terrassa, and in 2021 we decided to start the sustainability journey. For Mutua Terrassa, health and the environment are inseparable, and in order to contribute to our society's health improvement, we reaffirm our commitment on the environment care and sustainability. So when we started this journey, we had very clear that we wanted to focus in our patients. First of all, we wanted to not be harmful. That's why we use the Hippocratic Oath, primum non nocere, which means, first of all, do no harm. And under these lines, we started, first of all, with a first climate action plan. We wanted to make it very simple. We wanted to create wide, understandable, and memorable lines of action to create impact in the entity and also in our citizens. This was a way to start and to start giving awareness for our workers. But then we started to develop, now we know ourselves better after that, and in 2024 we decided to make more precise an action plan that could deepen more in the actions or in the implications that our entity is having in climate change. So we decided to make this second climate action plan. That is the same that Rosa explained before. We thought it would be nice for us. We made 12 different axes, lines of action, and we filled with information, filled with specific actions we wanted to implement, and also our own objectives. But when we share it with the Salud Clima group, we found out that it would be nice to share it with other hospitals and to use it as a form of more collective plan. So we had our first climate action plan, then we had the second one, but the second one is an evolution of the first one, and we have three purposes, the same three purposes. The first one is to decarbonize our entity. The second one is to adapt our activities and citizens' life to this new reality that the climate change is drawing, and to act as an awareness drivers for our society. And under these three lines, we started to make lots of plans, lots of actions. And now I'm going to start explaining them. Please, Ilya, if I exceed the time, okay, tell me, because now I have lots of things to explain. Well, I'm going to start talking about the energetic consumption. As hospitals and having lots of facilities means for us to be a huge energetic consumers. So the first thing we had, or the more easy, between lots of commas, thing to do was to contract 100% certified energy, green energy, which means that all of our facilities are provided by green and renewable energy, but we wanted to go further. We know that energetic transition is not only about decarbonizing our entity, but to be self-consumptions or energetic producers for ourselves. And also we wanted to keep being consciousness drivers, and we wanted to reduce our consumption. So after that, I'm going to explain you one of the biggest projects in Mutua Terrassa. What you see here is a prospection on how the hospital is going to look like after the project. We are making the refurbishment of the hospital. It's a 50-year-old building. It's very energetic. It's a huge consumer of energy, and it's 16th floor tall. And we are going to make a refurbishment to improve the isolation of the whole building. We are going to reduce our consumption by 30%. And the last thing we are going to do is to outfill with solar panels all our walls. What you're seeing here in black are solar panels, and this will help us to make autoconsumption. I don't know how to translate it, but we are going to create the 15% of our electric consumption. But we keep going further. I'm sorry. And we are working to make a solar park that will produce the same amount of electricity that we are consuming in our hospital. And we also work with different associations of our city. In this case, this is Teatro Regina, is one theater that is very emblematic in our city. And we have to must be refurbished, and we are working with them. And at the end, the rooftop are going to be filled with solar panels that will also provide renewable electricity to the hospital. But we keep moving. If the energetic consumption was one of the main areas to focus on, we also have our patients and our workers' mobility, because this is from Scope 3. As my mates talked before, Scope 3 is a little bit difficult to work on, but we want to get into too. So we are making two major things. For patients, the ones that are referred to the specialist, if your family doctor refers to the specialist, allergology, pneumology, we give you an SMS, a phone message, so you can find alternatives to the private transport and make your transport more sustainable. And for our workers, we have workers from other cities. So what we made was to take a parking in the outskirts of the city for workers that comes from other cities, so they can park in a secure place and they can come to the hospital by train. So the center of the city is not too polluted. If something is not clear, later on we can talk about it. Another big project, Axioma Solutions. I told you that we have laundry and sterilization enterprise. In 2010, a new law appeared and banned cotton textile from being used in the surgical area, which means that all the textile that you are seeing here in blue and was made of cotton disappeared, and hospitals needed to use single-use materials. Axioma, which is our enterprise with Tecnotex, that is a textile enterprise, made a new textile that has the same compleix la norma, sorry. Accomplished all the law while it was capable to be reused by laundry and sterilization circuit. And as a result, each year we are reducing 160 tons of waste, and Axioma not only provides our hospital, but hospitals all around Catalonia. We also have a whole strategy for recycling in all our facilities, but as we are sanitary waste producers, we must be aware of how to make waste segregation properly. And we saw that, we were segregating, recycling all the municipal waste, but we saw that in the surgical area we could also implement it. Our nurses decided to create a project based on recycling the packaging of the single-use materials. They are packed in paper and plastic, so they asked us. Now we have, in the surgical area, each month we are recycling 2 tons of paper and 1.5 tons of plastic, which is not a small amount. We keep doing other things in circular economy, like this one. Our mates were also talking about circular economy and things that were already created. This is one of the things that we could say. In ICU and hematology, we have a critical patients that need very specific environment, and we give them, we hydrate them with water, with bottles of water. Until 2025, we were using plastic water bottles, but we decided to change it. Why do we have to give them water bottles if there's another kind of bottles that can serve? Now we are using glass water bottles, and they can be reused 18 times. So we are reducing the plastic waste of all these bottles of plastic for each one. Other things, we are working to reduce our waste, our food waste. We are working with social benefit entities to preserve all the food that it's excedentary food that comes from the canteen, and we give it to social benefit entities. We also implemented sustainable criteria for food providers. And I'm finishing. Last thing, reusing expired material. There is some material that that gets expired in the clinical areas that can't be used with patients, but we have a simulation area where when we have practices of residents and nursing and medical students. So we decided to recover them and not to throwing them to the landfills, and to reuse them in these spaces that have no risk for patients. And last but not least, all the part of adaptation. We have a research foundation, as I told you before, and under this foundation, we created the Health and Climate Change Chair with the University of Barcelona. We are also working in research study on the impact of climate change on people with chronic non-communicable diseases, and we started also a new research on climate and Alzheimer's disease study. And last, Sustainability Prescribers Program. I told you before, under the White Gowns Authority, we can become sustainability prescribers, and we work in this line, making more sustainable care models, working with Green Pharma, trying to promote sustainable and healthy habits, and also working as a consciousness driver. That's all. Just to remark a Native American proverb: the planet is not an inheritance of our parents, but a loan made to us by our children. And it's our responsibility to give them in good conditions. That's all.
Thank you very much, Laia. This event is actually one of the main aims is to allow exchange of best practices from around the world. And the Erasmus Medical Center University Hospital from Rotterdam is one of them. We are having Jasper Klassen, who is a PhD candidate and works at the Erasmus Medical Center, focusing on mainstreaming sustainability in each and every step of the hospital operation. And his research, his recent research is based on tracking the pharmaceutical waste in the hospital of Rotterdam.
Let me see. Oh, perfect. Yeah, thank you very much. Hi everyone, my name is Jasper. I'm a medical doctor of origin and also a PhD candidate within the ESCI consortium, part of a sort of nationwide research on sustainability research, and a part of the Erasmus Medical Center. So the Erasmus Medical Center is the largest academic hospital, teaching hospital in the Netherlands. We have a 50-bed ICU, and we deliver all types of ICU-related care, such as ECMO, which is heart replacement therapy for the non-medical people, and CRRT, which is for kidney dialysis, so kidney replacement therapy. And we see about 2,500 patients admissions annually, with an average length of stay of 4.5 days. So that's a lot of patients and a lot of days that they are present at our intensive care units. And in that time, we have in total about 1.1 million medication deliveries annually. And that's for 1,800 different types of medications. So, as is mentioned before, the sort of gold standard for for measuring the impact would be to do an LCA. So if we want to do that for the entire medication that we use, we would need 1,800 different LCAs, which is a bit problematic because you want to be able to compare them and have them verified, and they don't exist for most of the majority of the medication. So you run into some problems if you are a hospital and you need that information. So one of that is that the data is not available because pharmaceutical companies say it's confidential or that they don't know it. The data that is available is not verifiable. And usually manufacturers are not really measured but are sort of estimated, as was previously discussed. So it's sort of, it's sort of a black box. And additionally, a lot of the impact is outside of the control of the hospital. But you want to think about things that are inside of your own area of influence as a hospital. And that's very difficult with the scope 3 emission practice, is that, they're not my emissions, so it's very difficult for me to sort of change them, but still they are also my responsibility, so I do need to sort of try to reduce them as well. So what can I do then? So what we did is we thought about, what other ways can we use to study it? And especially considering I'm a medical doctor of origin, I'm not an LCA expert, but most medical doctors are no LCA experts. They don't even know what it is. So it's also very difficult to explain that to them and to understand the science behind it. But you do want to get the medical professionals on board as well with your interventions that you're trying to do, because you need to get the medical staff, doctors, but also nurses, along with the circular change that you're trying to make. So what we ended up, one more thing to note as well, with an LCA you get a very exact number, and as a medical professional I like my numbers. I like to know exactly what the heart function is, or the heart rate, or kidney function. So the more specific a number is, the more confident and safe I feel. But there's a problem with LCAs, is that they give very specific numbers, but the question is that actually a very precise number or a very accurate number? By that I mean that the number itself can be very specific, so like something, 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 comma, something, 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 and I would feel, oh, that's great. That's a very specific number. But it might not be very accurate because of all the assumptions that underline the model. So what we did with Azure is that we've sort of used a different approach instead of an LCA, which is a material flow analysis that we've used. And here is an example that you can see that's done for the entire intensive care unit. And what the material flow analysis does, very simply put, it looks at the input of all the materials that enter, it weighs it, and then it shows you how it moves around. So it goes also from usage to disposal. And what you can see, or actually not very that good, but what you can see is that the medicine, which is this box, was the biggest, this box was the biggest source of material that we had in our intensive care unit. So we wanted to delve into that further. So what we did is we performed an MFA, material flow analysis, for the medication in our intensive care unit. And how do you do that in practice? Well, you have to look at it all and carefully measure every single aspect of every different product. So we took, so just to clarify, we didn't took 1,800 different medications apart. We took the most commonly delivered medications apart, everything that was delivered more than 250 times. So there was in total 420, 440 medicine, and they represent over 94% of the total deliveries. So, 420, that's doable. It was still weeks work. And one of the good things about being a PhD student is that you can actually get to do the work yourself. So, we took every piece apart and we weighed every individual information leaflet or package insert to see what the actual weight was of everything, because that was what we needed to do. And an MFA is very simple. Simply put, you weigh something, you times it the amount of deliveries that it has received to the department, and you get a total weight, which is understandable even for doctors. So that's good. So if we look at what are the results of the slide, it's sort of visible. One of the things that we found out is that when you prescribe medication, for instance, if you look at one of the most commonly prescribed painkillers, and especially something that medical doctors in the Netherlands like, is paracetamol. Then you prescribe that in a sort of tablet form, or mostly it's like 500 milligrams per tablet. But the tablet itself doesn't weigh 500 milligrams. The tablet itself weighs 2.5 milligrams. Because it's 500 milligrams of paracetamol and 2 grams of filling materials. And those filling materials are actually relevant. They are meant to make sure that the tablet stays together. They prolong the shelf life. If it is for children, they might also add some flavoring, which some people like, but most people think it still doesn't work that well. But that is relevant stuff in there. But that is all stuff that is attached to it. And there's also packaging surrounding it. There's additional packaging. There's the package insert. So there is a lot of things that come along with the medicine that is prescribed. So if you look at what is prescribed, that's the active pharmaceutical ingredient, is what we call that. That's only annually 5.2 thousand kilos of medication. But everything that is attached to that totals 244,000 kilos of medication. That's a lot. And when we started off, we knew that about 1/5 of that was tablets, 1/5 of that was ampules, 1/5 of that was infusion bags, you know. Everything we thought, well, that's all sort of similar. And we thought about, well, maybe we can change the design of the blister packaging, so that's for the tablets that you can press out. And maybe that, you know, we can make an impact on that, because maybe if we do like a honey crate system, we could add an additional tablet, and, you know, we would have saved the world back there, and that would be amazing. But then when we actually look at the results, that we saw that, you know, infusion bags were responsible for 173,000 kilos, whilst the blister packaging is so low that you can't even see it, I think. It's only 222 kilos. So the impact of changing that will be, you know, very small. And that's actually one of the things that helps us when we do these types of research, because this allows you to think about what are the things that we as a hospital can do to make sustainable decisions. Because, for instance, the packaging of the infusion bags, we didn't use to recycle those. So we just incinerated that. But then we ended up with going for recycling, and now we ended up with recycling about half of the total packaging that we had at the department. And that's a very, you know, it's very important to be aware of the impact of some of these materials and dosage forms have, because that can also allow you to make a change. So one additional example is that what we see right here is that the fluid formulations are way more, contain way more additional packaging materials, etc., which also makes sense, right? Because I have an ampule as a glass vial, or I have a vial box that also has aluminium and rubber and everything in it, or I just have this very small blister which doesn't do anything. So one of the things that we actually try to do as well at our intensive care unit is to get doctors to prescribe more oral medication forms. One of the benefits of that is that it's also cheaper, so hospital management likes that. And it's also something that is inside of the scope of the hospital. And the API, so the active pharmaceutical ingredient, stays the exact same. And we are aware, of course, that the majority of the climate impact is in the API production phase, but that doesn't change. So one of the things that is within your scope is which formulation method you choose. And that's why we are suggesting to do that as well. And we also try to send it out to other hospitals. So we have a very huge paracetamol, which I showed last year as well. And then we send it out to different types of hospitals to also get them on board with this. And that's really working well. So, yeah. This is what the annual patient receives of medication daily. So that totals 5 kilograms of medication and 1.7 kilograms of packaging. And that is a total, if you add dialysis, which is the biggest source of waste, you get 14.5 additional bags of infusion bags, which weigh 50 kilos of medication and 5 kilos of packaging in itself. So it's a lot of waste from dialysis, which also shows the need to work on dialysis as well. And that is basically what I had to say. The takeaways are: often information of LCAs for hospitals will not be available, and therefore to think about alternative solutions that can be used. And you also need to critically review the LCA studies that do exist, because they sort of are a black box and difficult to sort of reproduce and understand. And lastly, the material flow analysis could provide an alternative approach that can be used if you especially want to look at the hotspots that you can identify in your own care setting. That's that.
This is a very nice link to the next presenter. And when we are comparing scientific research attempts, you highlighted that it's impossible to have a life cycle assessment of all the medicals that you use. But at least we could try to have life cycle assessments of the medical equipment that we are using. And that's the topic of our next presenter, Maria Iordanoglu, who is a young researcher from the UNESCO Chair of Life Cycle and Climate Change, focusing on implementation of the life cycle assessment as a research model for assessing the environmental impacts of medical equipment.
Thank you so much for the introduction, Iko. As mentioned, I'm going to be speaking about life cycle assessment to improve the sustainability of medical equipment. For this reason, I'm going to be talking about the Green Electro project, which is a new project that we are participating in, along with 4 other Catalan research groups. And the goal is very specific, is to develop a bio-based electrode for sustainable and circular solution for clinical diagnostics. And how we want to do that, we want to substitute non-renewable materials for bio-based alternatives, and our team's contribution is how we can use LCA to do that. As it has been mentioned before from many speakers, due to climate change, higher mortality has been noted, and additionally, climate change coupled with the aging of the population is going to cause more hospitalizations, and we're going to need more cardiovascular monitoring because the cardiovascular health is supposed to be deteriorating. And for these reasons, we will need a ECG recording to monitor the cardiovascular health of people, and typically per 1 ECG we need 10 single-use electrodes. In the European Union, around 100 million ECGs happen annually, which if we do the math, it means approximately 1 billion of electrode waste, along with the packaging and along with other electrodes that they're not used. According to the data from the Generalitat de Catalunya, electrode waste is supposed to be a type 2 medical waste, meaning that it undergoes no specific treatment and it gets assimilated to the municipal solid waste, ending up in landfill and incineration, so there are emissions that are generated by the treatment. However, emissions are also generated for the production of the electrode because, as we can see, it consists of a typical electrode of many different materials like metal and plastics, and also emissions from the fabrication. For this reason, we get to the goal of the project, which is the development of the biodegradable nanocellulose-based electrodes in order to mitigate the environmental impact from the daily use of large quantities of electrodes. So in order to create these, there is one of the research groups that are involved in this project that they are developing cellulose hydrogels that will be used in order to have a prototype of an electrode that is supposed to have the form that you see over there with various layers. But in order to be sure that this is functional, it needs to be compared with functionality of a regular electrode, and to compare the signal of one ECG done with the green electrode and the regular one. So as mentioned in the beginning, our team's expertise is in life cycle assessment and how we can use that as a tool to develop this electrode. Briefly, I think most of you are kind of familiar with LCA, but briefly it's a methodology to evaluate the environmental impact associated with a product, a process, or a service throughout its life cycle. And in order to do that, we use specific environmental indicators. When we do an LCA, we follow these 4 stages that they are all interconnected with one another, but it's not a linear process, meaning that we can go back if something is not serving us and make all the necessary adjustments. what we want to do in this project as a first step, we want to do an LCA that is going to serve as an eco-design guide to design our sustainable electrode with fewer carbon emissions. And the environmental impact that we will be estimating is the impact of one rapid ECG that is lasting 1 minute and is needing approximately 10 electrodes. Here you see a kind of simplified flowchart of the system that we are going to be examining. Starting from the raw materials for the electrode, for the components, the manufacturing of the components, and ending with the end of life and how the waste is treated. But it's very important to establish and kind of quantify all the inputs and outputs in order to have the results and in order to be able to examine the environmental impact categories. Our focus for the eco-design is climate change category, meaning we want to identify the stages, which of these stages has the highest CO2 emissions. And after we have identified this, we're gonna move to the eco-design, and we're using as a tool to guide us the eco-design wheel so that we can come up with strategies to finally do a sustainable design of the electrode and considering all the life cycle stages. The idea is that we identify the improvement areas in which our developed electrode is going to have a better performance in terms of climate change by using new materials, like biodegradable materials, materials with fewer emissions, creating a smaller device, and a device that uses minimum amount of different types of materials. And after that, we're going to do an initial material selection for the different layers of the electrode. And after we have done that, we will need to do a comparison between our electrode and the commercial electrode to be able to assess the mitigation of the environmental impact, because it's true that our electrode is going to be designed in order to have less carbon emissions, but then we need to know what is going to happen with the other environmental categories. Again, this is not a linear process, because for the first comparison in the LCA, we're going to have a theoretical structure of the layers, but then it's a constant communication between the LCA practitioners and the people that are our partners that are manufacturing the electrode, because we want to have a balance between functionality and environmental performance of the device. Thank you very much.
Some minutes for questions and answers. Do we have some questions from the audience? And as well, the audience which is online can as well send some comments. Do we have some questions from the audience here? Yeah, Daniel?
Why is Catalonia so good at this? Is it any special event? Is it a political decision? Is it where is it a person, a politician? Is there any answer? Why?
The truth is that the different entities that not are under control of politicians are the real movement. Yes, for example, Unió Catalana Hospitals, Consorci Sanitari, and other groups or working groups are the real movement, not politicians. We have had a lot of change of governments, and in that way it's very difficult to implement real actions and real regulations to improve that change. For example, our activity in our surgical area is has a big price. Instead doing an activity with recycling, don't use reusable clothes, for example, but we are paid the same amount if we don't do nothing, and this is a problem for us.
I agree with Miguel Angel. I think in our case was the awareness of the CEO, of the executive directors, and they were the motor, and also our workers. We have very aware workers, very a lot of implication, and lots of projects come up with them. The surgical area recycling process comes with nursery team, and then other nurses from other areas decided to join the project. And I think the workforce is a huge part of why we are doing it, and also being part of private healthcare providers is also a good fact. I think we have, I don't know how to explain, but we are more fast. We are faster in taking decisions and deciding where to put the money and where to implement certain things. With politicians, we had not this support.
Thank you. We have another question. Yeah. No, baby.
Thank you. Yeah, I just want to say I'm really impressed of like what you implemented, like all the processes and building a really sustainable hospital. And my question is very similar to the first one. I wanted to ask, like, how were you able to convince your CEO or your like economic leader to actually like implement it? Because I guess it's a really huge cost point for most of them. Like, what were the concrete arguments like from an economic side?
The truth is that our CEO comes convinced from home at the institution. The truth is our CEO has been in the institution from a long time. He has had a great commitment with the sustainability, the environment protection, the social matters. And we are a small entity, and thanks to it, it has been easy to implement all these actions.
In our case, the truth is that the previous Green Commitment Department Director was Josep Rull. I have to say that he is a politician. And we had lots of support by his part. He was the biggest promoter of the sustainability in our entity. CEOs decided to support him, and right now the Green Commitment Department is part of the direction. We more or less like see.
Any other question from the audience?
I have more than a question, is a comment or a suggestion for Jasper in that case, because I completely understand your frustration when trying to face an LCA assessment with such huge amount of products. And I want to say that you did the most costly effort when doing an LCA, that is identify the different materials and to weigh them and everything, so that this material flow analysis is a big part of an LCA, and I think that you presented this material flow analysis as an alternative for an LCA, but I think it can be complemented by an LCA. So once you have done this material flow analysis, you can use also LCA approach and LCA databases to complement your study. So I think that you should think on complementing it through an LCA.
It's an excellent suggestion. It's actually something that we've already done, is for every part of everything that we've weighed. We've also carefully weighed which material components are there and the amount of these material components. So the next step indeed is to sort of attach emission factors to that, and therefore you sort of already have done a quick and dirty LCA. But my frustration was more or less had to do with the fact that, you know, from a sort of utopic idea, you would want there to be a material passport for every product that you buy as a hospital. You want there to be LCA data that's like standardized, so that you know, everyone there's one agreement on how you should do that and what things you need to put in and what things you can assume and how much, etc. So you want the rules and regulations in place that there's sort of credible LCA data. And I think that in reality we are moving towards a time where that is present. You know, everyone is working on, you know, these standards, etc. So my assumption would be, or my hope would be, that in 20 years' time there will be LCA data for every medication, etc. Because it would just be mandatory. Because the message would just be from the procurement side. You know, we will not buy it from you if you cannot show us the environmental impact of the product that you're selling us. So what we're trying to think about is sort of how to bridge that gap. So how do we already start to work on things when we don't yet have those credible data? And in the end, of course, I mean, the LCA still is the golden standard. So in the end, you want there to be great LCAs. But right now, out of the 1,800 different types of medications, we could only find like 2 or 3 LCAs that were like sort of proper quality. Yeah, and the one other problem with the LCAs is, of course, that it's very context specific. So the energy mix of the country that you're analyzing it in, or the time that you're actually researching it, especially in this time when all of these companies are also trying to really make a sustainable change, then the LCA that is performed in 2020 might be completely irrelevant in 2025 because they've also, you know, changed their production process to make it more sustainable. But it's a very good point that indeed you need to
alternatives,
watch.
and you can use it like having the big picture and just where to focus, because sometimes, because you're doing a material flow analysis and you identify this is 100% of the material that I'm using is that one, but perhaps the one that you're using 10% is the one that has more impact. And if you focus the strategies there, so I think that for this, just the big picture, that you don't need to be everything certified and so on, just to focus your strategy. I think it would be interesting to try to somehow to implement and also to do some scenarios for this electricity mix. So you have plenty of alternatives to put that. We can talk afterwards if you want.
I completely agree with you. Yes, perfect. Thanks.
Okay, thank you.
Thank you very much. Do we have some other questions? Yes, we have. Okay, Dhruv.
So I was really amazed to see the circularity and the sustainability in the system, specifically in such a linear domain where you're trying to achieve like net zero. Have you ever came across collaborations from second world country? Like, I'm from India, I do not see any sustainability, and especially in health sector. So have you came across such things or collaboration where you are helping second world countries to develop their system in a sustainable way?
If I could quickly answer that first. So so my PhD is a part of the Azure consortium, which involves different types of companies. So Philips, Medtronic, and all these other companies that are world players are on board as well. And their sustainability strategies are not only surrounding the European or the American region, but also the world as the playing field. What we do find out though is that it's also a market thing. So there has to be demand for producers to actually work on more sustainable products to sell. And that demand is definitely existing in the European market and is growing rapidly, but the demand is not quite there yet in the same level as it is in Europe in other places. Which also makes sense because you first have to sort of your primary concerns are like improving the access instead of just making it more sustainable. However, I would say that I recently had a talk about the Aravind Eye Hospital in India. It's the largest eye hospital in the world, and they are actually actively working on that. And it shows that their current practice, and partly because of their scarcity in materials, is already like 15 times more sustainable than for a common eye procedure than is the case in the Netherlands. So I would say that the largest amount of waste of single-use products, is actually in the first world countries. Yeah. But we need to work more together with, we need players from around the world to sort of make this sort of a thing that we do together. Yeah.
Thank you. We have one more question here. Is it? Yeah, perfect.
See? Ah, vale. Mine is a very general question, and as I was saying at the beginning, I'm totally out of the field of healthcare, so it might be maybe naive or something, but has anyone tried to measure how much the level of sustainable practices of a hospital, especially in the private care, is an influence on a patient choosing to come to your hospital instead of going to another one, and whether that can be a sort of a incentive for the CEOs as well to improve sustainability, considering that maybe some patient can choose to come to your hospital based also on this type of practices?
Well, maybe the other stakeholder is more important. What we see is that healthcare staff really wants to work in hospitals who are more sustainable. And healthcare staff is very limited available, so they're really scarce. So we see that hospitals are really working on sustainability to keep staff working for them. We also do research with the patients, but that I don't know the much details, but one of the steps would be that we are now start thinking of, showing not only like if you have two different kind of two different types of treatments, to show not only like, what are the risks, but also the environmental impact of it. But patients are important, but healthcare staff nowadays is even more important.
I'm 100% agree with you. We have the Passion Council. We participate with them, collaborate and explain all the project, and we receive a lot of agreement. But the most impact is the professionals. For example, we have a lot of professionals that had said, I'm involved in that project, in that hospital, I will stay here. We have a big problem now with nurses. We don't find nurses anyway. And for us, that green commitment and having the people motivated is a big opportunity to have the people that avoid to go to another place.
Yeah, we have to take into account that the patients don't decide to come to our facilities or to our activity. We are providers of Cat Salud, which means that we are giving a public service. But as a private entity, we are able to do some things. That's what I meant to say. I agree with Miguel Angel. I think the capacity that we have to absorb or to be catchy for is more for the workers and the workforce than for patients, because they don't have the chance to decide. I'm not sure if it works.
Yeah, it works.
Okay.
Yeah.
If I could add one small thing.
Yeah, sure.
So in the Dutch system, the patients are not necessarily the healthcare purchasers, because there's mandatory insurance, so they are insured by a health insurer, and the health insurer is actually the purchaser of the purchase of the care. And the health insurance companies are actually more and more asking about sustainability in their purchasing of care. So there is also that sort of top-down pressure for CEOs to sort of combine with the change as well. Yeah.
Thank you. We don't have any comments from online, so that means that we are exactly on time. I would like to ask you to give the panelists a round of applause. Thank you very much. We are left with only one more session, which is related to sustainability education. There is one very interesting initiative which is funded by the Erasmus Europe, by the European Commission, and it's called the DesHealth Project. They are trying to address the gap which is in the education, which is in between the healthcare professionals and as well the future sustainability managers in the hospitals. Therefore, I have the last speaker of the day. That's Dr. Amina Pereno, who is a professor in the Politecnico di Torino, to present some interesting findings of the project, as well the educational platform that we will launch very soon. Just use that.
Okay. Thank you very much. here I am. Okay, thank you very much for your introduction, and thank you for organizing such an amazing afternoon. I'm really proud to be the last speakers of today's. I promise to be very quick in my presentation. As a project coordinator of DesHealth, so Daniel asked many times about systemic design, but unfortunately for you, I won't speak about that today. I will just introduce our joint effort in addressing this topic. I don't think I need to spend many words on this slide, because today you already stressed how healthcare could be impactful on our environment, on our planet. Fortunately, at least at the European level, awareness is increasing faster and faster. So today also we receive many insights and inspiring use cases about how sustainability can be implemented in practice. But we are also aware that many industries, many hospitals in our countries still lack the tools and the knowledge to start and to address these challenges that many of you already knows. So that was our starting point as an Erasmus Plus project. So DesHealth has a common goal that is to provide a contribution in filling this gap on sustainability knowledge, so promoting, of course, a transfer of knowledge and share of good practices and methods and tools to start addressing these challenges. Being an Erasmus Plus project, we have specific goals for education. So education is not about research, it's about education, it's about communicating and transferring the knowledge we already gain in our different field, in our different experiences, to build co-disciplinary and cross-sectoral collaboration around a common topic and a common goal, that is sustainable healthcare. So we want really to give our contribution in leading the way and paving the way to sustainable transition in a European context. So today I want to briefly introduce the first big outcome of our project, that is a learning journey through sustainable healthcare. We call it like this, want to be a journey for students, for present practitioners. So the idea is to really provide a tools for present and next generation of professionals in healthcare. We collaborate together. As you may see, we are 7 partners from different countries, but also very different backgrounds. From design and management, we focus on these 2 disciplines because we are also aware of the impact of supply chains. As we said today, it's very hard to get sustainable products and to have information about that. So focusing on supply chains and on the goods we are consuming in our hospitals, in our industries, is really important. And we also put together many different types of partners, from hospitals to industries, so the idea is to really be comprehensive. The training is the idea of the training is to share and provide knowledge, but also try to be very practical, so to provide methods and tools for addressing sustainable healthcare issues. That's why next week we will launch the first part of the training that is made of 4 online modules. So we will have a 9 weeks time frame for attending these online modules that are self-paced. And we will complement this online part with a second part, that is the 5th module, that will mix online and on-site practice to really teamwork on practical issues of sustainability in healthcare.
Module 1 to 4, as I mentioned, that deal with sustainable healthcare in general, with design and management in sustainable healthcare, are online and self-paced. So the idea is not to provide live video lessons, but to mix different interactive contents, self-explanatory presentations, and short videos and movies that can really provide key concepts and also very practical tools that could be applied in your daily professional life. And the 5th module will be hybrid, so we will have local teams discussing with other local teams around Europe to working on the issues that our partners in the project are providing. So we will include challenges that companies in the medtech sector, in the pharmaceutical sectors are facing, with other issues that hospitals may experience. So we will work on this different topic. This is a detail on the content we will cover. So as you may see, we won't go into the detail of specific topic. We want to be general because we think that this training program could really help many different sectors and can be applied to many different also disciplines and the issues. So we will we will start from an introduction to sustainable healthcare. Today you have a preview of many of our great teachers and speakers that you may find also in our training. Then we will move to systemic design for sustainable healthcare that is led by us, to sustainable management for healthcare. So ESCI-UPF will go more in detail of some also of the issues we mentioned today, from life cycle thinking to carbon footprint. And then we will focus on sustainable product service system for healthcare. So again, going further with some of the circular strategies we mentioned today. And our, we can say, professional partners, hospitals and industrial clusters will come into the last module to really provide a real-world perspective on healthcare. So not to be theoretical, but to really be practical. We the idea is to launch in these windows, in these time windows, a pilot. So any one of you here on the line could also have the opportunity to participate in the training. What you will get, of course, is a self-paced and exclusive online training. So you will be the first to test our training. So this could be positive or negative. We really hope this will be a great experience for you. You will have the opportunity to have international trainers, to have, of course, this online exchange of concepts and methods from different disciplines, but also practical discussion in the last part of the training. And we think that the strength of our training is also this interdisciplinary approach. So it's not about design, it's not about management, it's about sustainability in a very horizontal perspective. We really invite you to get more information and also to take the opportunity maybe to register to know more about the training and consider the possibility to participate in this first pilot and the first proud result of our project. So here the QR code, but also we will share, I think, the presentation and all the information that are also available on our website. So there's a page for the training project. You will find all the information. Thank you.
Thank you very much, Amina. I will have to start the session of questions. Is there any prerequisite for the future participants in the program in terms of education or experience, or it's open for everybody?
Well, the training will be, the pilot will be open for everyone who wants to attend. We think our target audience was for people with at least a degree on some of this topic, and but I really believe the most important thing is the motivation, so that drives you to participate in this training. So I think that a common interest in sustainability and in healthcare is the main requirement for this training.
A common interest, that's a very nice prerequisite actually. Do we have some questions from the audience? Alba? No. Benny? No. Okay. Some comments from online? Yeah. Then we will share actually the presentations and the link for the piloting. Now, what else can I say? I hope that this is a beginning of a continuous consultation in between the academia and the practitioners that can push the health sector towards sustainability just a bit. I would like to thank you all for your time. I would like to thank the presenters for their preparation, and thank you for your participation. And for the future participants in the educational program, I wish them best of luck in the application process. Thank you very much for your participation.